folks will be trickling in for the next few minutes. Welcome to the third and this year's final event in our Lessons from the Field series on relational aggression. We're pleased that you're all here, and we're pleased that you can join us in host sites around the state. My name is Joel Hetler. I'm the director of the Center for Excellence in Children's Mental Health. We are housed within the Children, Youth, and Family Consortium, and as of this year, we're part of the Extension Division at the university. We're pleased that you could be with us. I want to thank our partners and sponsors and co-sponsors for helping make this possible. And this year, that includes our major partners, the Institute of Child Development and the Center for Advanced Studies in Child Welfare, as well as Minnesota Adopt, Center for Leadership Education in Maternal and Child Health, and we are fortunate to have extra grant help from the National Institute of Health, from the Eunice Kennedy Shriver National Institute of Child Health and Human Development. So we couldn't be here without all that assistance of those folks and without your participation. We are broadcasting to 28 host sites around the state, and we thank you all for your participation and commitment. I looked at the weather this morning, and I think this may be, for some of you, the third event of the year that we've hosted that has coincided with a snowstorm. I hope it's not bad in your area. So far, it's just cold and wet here. We're really pleased that we're able to do this, use the broadcast technology to bring you into our program. Just a quick mention before I talk about today's series. Next year, we're going to look into possibly a new format for Lessons from the Field events. And we want to tailor our programming to have more impact and relevance to you folks, our audience, as well as be more accessible and less expensive. So we're looking at new ways of delivering programs. We invite your input. One way that you might be able to give us input is at the MACMA conference in May. We're going to be hosting a focus group specifically to talk to people about what their learning needs are and their preferred learning styles and how we can interact most effectively with you. If you plan on attending the conference and you want to talk to us or get more information ahead of time, you can see our Associate Director, Carrie Michael, at the intermission or at the end of the conference today. In your folders, please note you should have the schedule for today's events, Dr. Leff's PowerPoint slides, an evaluation form, and please be sure and fill those out. We really depend on your feedback to help us do a better job. And also you will have a 3x5 index card. We're continuing our strategy this year of asking you to write your questions down and turn them into one of our volunteers so that we can use them during the Q&A section. And for those of you in greater Minnesota, if you submit your questions online to cmhdata, cmhdata@umn.edu, we'll make sure that your questions are also included in the question and answer period. Lastly, for those of you who are looking for CEU credits for this morning's events, certificates of attendance will be available as you leave. A couple of housekeeping questions. Again, please remember to jot down your questions as you listen to the various speakers, and we'll have a 30-minute Q&A at noon. For those of you who are attending the afternoon session here at the Metro location, there's also information about lunch opportunities in the food court or here or the campus club on the 4th floor of Kaufman Union. If you are going to go to the campus club, you will need a guest card, and those are available at the registration table. For those of you here again, restrooms are available outside the entrance to the theater to your left and also at both far ends of the building. One last noise reduction announcement. Coordinator at host site, please make sure that your sites are on mute. And for those of you here in the audience, please be sure that your cell phones are turned off or on vibrate. With that, I would like to again introduce Dr. Nicki Crick, who will in turn introduce Dr. Leff, who's today's presenter. Dr. Crick is a University of Minnesota professor and director of the Institute of Child Development and also of the Center on Relational Aggression. For those of you who are not familiar with her work yet, she is really the leading researcher in the field of relational aggression. Her research has included studies on preschool aggression and groundbreaking research showing the importance and relevance of the concept of relational aggression as a tool for understanding the difficulties of all children, particularly girls. In her presentation, What is Relational Aggression and How is a Problem, on November 30th last year, launched this year's lesson from the field and is available on our website. And with that, I'd like to introduce Nicki.
Good morning. I would like to add my welcome to that of Joel's. And Joel, thank you for the kind introduction. I get the very best part of the day because I get to introduce Dr. Steve Leff, as Joel said. And he has a very long title, so I'm going to actually read this to make sure I get it right. Dr. Leff is an associate professor of clinical psychology and pediatrics at the University of Pennsylvania School of Medicine, and he's also a psychologist at the Children's Hospital of Philadelphia, also known as CHOP. You may have heard of that as well. I've known Dr. Leff for many, many years. In fact, since he was a graduate student. So it's been a while, hasn't it, Steve? And it's been a pleasure the entire time. Dr. Leff is a pioneer, groundbreaking researcher in the area of intervention for relational aggression. There are a lot of kind of ground roots programs that have cropped up around the country, and the majority of them are not based on research. They aren't evaluated. We don't know whether they work or whether they don't work. And Dr. Leff has taken the lead in developing programs that we know are helping children to reduce their engagement in relational aggression. And so it's my pleasure for me to introduce him, and I know that you're going to enjoy hearing about all of his efforts. One of the things that I like most about Dr. Leff's work, which you will hear more about from him, is the way that he collaborates with his community partners. For him, it's really a working together with the schools, with the children, with the school personnel in order to come up with his interventions, evaluate them, figure out what's working and what's not working. And I think in the research field, as many of you probably know or may have experienced, it isn't always that way. It's often a one-way street when it comes to researchers going into a context. And so Dr. Leff's research is completely different from that, and that's rare in our field. So with that, it is my distinct honor to introduce to you Dr. Steve Leff.
Well, good morning. Thank you, Nicki, for that nice introduction. And Joel, I'm very happy to be here today, and I'm excited to share with you some of the work that we've been doing around relational aggression interventions. And really also, thank you, we want to make it really applied So I'm going to talk about a lot of the work that we've been doing, but I'm also going to focus towards the end of the talk on strategies and things that we can think about, not just in the research realm, but hopefully that have practical implications for all of us. And before I start, I did want to acknowledge we have a fabulous team back in Philadelphia at the Children's Hospital of Philadelphia, including some phenomenal community partners and teacher consultants. And the work I'm going to talk about today, we've been fortunate enough to receive 3 grant funds over the last few years, which I also wanted to acknowledge from NIMH. So today, what I'd like to do is first to present current research on relational and physical aggression. And I'm going to do that relatively briefly. But then I wanted to talk about some of the school-based efforts to try to reduce relational and physical aggression. And as I said, then to end by talking about strategies that we can take away from this, and hopefully that'll help with the case discussions and the panel coming up following my talk, as a way of thinking about what can we do to really help students, parents, and teachers recognize and respond positively to these unfortunate events that happen all too often. So I'd actually like to start with a discussion, and I want to open it up. The first question, and this may be a little bit too obvious, but in what ways do you consider children to be aggressive? What encompasses aggressive behavior, do you think, from your experiences?
Budging in line.
I'm sorry?
Budging in line.
Yeah, budging in line. Okay, great. What else? Exclusion. Yeah. Other things? Physical aggression. Okay. Rumors, sure. Rumors spreading. Other things. Name calling, yep. Right, and we're going to talk a little bit today. The comment was on Facebook and sort of through the media. We're going to talk a little bit towards the end today about some of the newer modalities that children are unfortunately bullying others. And I think it's important that we include those modalities as well. Other things. Yeah, intimidation in multiple ways. Yeah, okay. Next, so I think, and we're preaching to the choir here, I think everybody knows and everybody is really tapping on the range of aggressive behaviors when we talk about relational and physical aggressive behaviors. But let's talk for a minute about what are the types of problems that you see occurring because of these problems within the schools and within your communities. I'm sorry, can you talk a little louder? School refusal, right. That children are not feeling comfortable going to school. Other things. Fights, yeah.
Decline in academic.
That's a good one. Decline in academic performance. One of the arguments that we often make when we work with the schools within Philadelphia is that it's really important to address the social issues and behavior problems like relational aggression because they impact students' ability to learn and also to think clearly and feel safe within the learning environment. Other problems. Depression, yeah, and a lot of Nicki's pioneering research has shown that children who are relationally aggressive are at much higher risk of being depressed, certainly. Other things.
Retaliation.
Okay, I don't want to say it's a good one, but I mean, that's a good answer. Retaliation, yes. And I think when we talk about relational aggression, I think it's much more complex than physical aggression because it's not one incident that occurs and it's over. Many times girls and also boys hold on to that and it influences the behavior across different school settings and can cause quite a problem. Any other problems before we move on? Yeah, family conflict, certainly. And, sometimes it's different styles that parents may have with parenting around physical aggression and coercion, which can be related to relational aggression, but also just behavior problems at school can certainly cause a lot of conflicts between parents and children. And we're going to talk a lot about that in terms of strategies in a few minutes. And then finally, I guess why we're here today, but I'd like to hear, what are some of the strategies that most parents, teachers, counselors have tried to combat the aggression? What do you think are the most common strategies or attempts? Okay, so suspension, we certainly hear a lot about that in Philadelphia. Yeah. What else? Mediation, yep. So, yep, taking potentially the 2 or 3 children who are involved with a counselor, with a teacher, and talking with them about it. Okay. We're going to talk a little bit about that as well as the sort of surrounding social context that can support aggression and victimization. Other things?
Anti-bullying presentations.
I'm sorry, you said anti-bullying presentations? In the classroom, sure. Classroom-based presentations. Yep. Any other common strategies?
Adult supervision in unstructured areas of the building.
Yeah, and that's a great one, and I'm going to talk actually a lot about that. We know that the majority of aggression, upwards of 80-90% at the elementary school age, aggression occurs in the unstructured school context, playgrounds, lunchrooms, hallways. And so improving supervision and monitoring in those areas is an important area, and when done right can make a real difference. Great. Okay, so what I wanted to do before we sort of jump in full throttle to the presentation, so to speak, is I want to see by a show of hands, first of all, how many people believe in miracles? All right. How many people believe in miracles for the next 5 to 10 minutes so that we can go forward? Okay, great. That's a better answer. So what I want you to imagine now, I want you to imagine that, let's say right now, while we're here today at this talk and we're talking together, that someone is sprinkling magic dust in the schools, the communities, the practices that you work in, so that tomorrow morning, when you go back to your settings, there's no more problems with relational or physical aggression. Okay? So just picture that for a second. Think about that. No more problems with relational and physical aggression. My question for you, or my first question, I should say, is what would be the first sign that something had changed or that something was different? What would you notice first? What would people notice? Yep. Okay, quieter. Yep. Others? Everybody's smiling. That's a good one. So quieter, everybody smiling, maybe more calm. What else? Okay, the students would be doing their work and more productive. Great. What other things would we notice? Yep. Okay, so girls who had a tendency to be relationally aggressive, to isolate themselves and others, would be with other kids, more inclusive. What else would we notice?
Assistant principals wouldn't have anything to do.
That's a good one. Yes, yes. Assistant principals would have nothing to do. Yeah, yeah. Nicki?
Teachers and staff would be less stressed.
Yeah, teachers and staff would be less stressed. That's a good one. What else would we notice? First signs that something had changed, that something was different.
Kids might trust adults again.
Okay, that's a good one. Kids might trust adults again. So good trusting relationships and good communication. Okay, what else? Police would not be at the schools. Okay, yeah. Other thoughts? What would be different? So now what I'd like to do is to shift a little bit. And I want you to think about part of the miracle. And I'm guessing that there are times when at least part of the miracle has happened within your school, within your setting, within your practice, and maybe for a short period of time. But think about that and picture that for a minute. And then I'd like to know what was different at that time. What do you think was different at a time when, even if it was only for a day, you were seeing a calmer atmosphere, that there was trust between students and teachers, that it was a more productive learning environment, or that children were including others and not isolating others and starting rumors? What was going on at those times? Okay, can you say a little bit more about that? It was communication. Okay, people talking to each other, great. What else? Okay, so times when there was more respect in general, you were seeing more of this. Okay, what other things?
We saw that people were trying, whether staff and or students were making an effort to try to make a change and to not fall back on their habits.
That's a great one. So different times where there was really the concerted effort and the motivation there, where you saw a difference. Okay, great. Other things? Or what was different about these times? Great, so listening to the underlying problem, not blaming others. And unfortunately, I think that happens a lot with kids, with parents, certainly. Other things that were happening at these times.
Kids would take more risks because they feel safe.
That's great. So kids taking more risks because they felt safe. Okay, and then there was a comment over here.
Collaborative problem solving.
Okay, collaborative problem solving. Okay, so it sounds like a lot of times these sort of pieces of the miracle were happening when there was better communication, when there was more respect, when there was maybe more motivation for the collaborative problem solving. Yes? Oh, I thought someone had another comment. So what we're going to talk about today is how do we start the miracle, and what are the pieces so that we can start this process. Sometimes it seems overwhelming, and it's hard to think about where to start. My goal for today is first to share with you some of the research that we think is very promising in reducing relational aggression and engaging the community and students around these issues, but then also thinking about what are the strategies that you can apply and take back. So that's where we're going today, hopefully. So I think what we know, and again, I believe everyone here probably knows this, but aggression, both forms, relational and physical aggression that we're going to talk about, starts really early as preschool, certainly in the kindergarten classrooms, and it happens often. Studies have shown that almost a third of the children, and the school-age children, say that they are the victim or the perpetrator of relational or physical aggression really on a daily or weekly basis. It's amazing when we think about it. As I mentioned before, the majority, especially for school-age students, happens in the unstructured school context. The playgrounds during recess, the lunchroom, the hallways, sometimes in the classroom, especially when the teacher's not present, such that there's a substitute teacher. And then different studies have shown that not only does aggression happen frequently, but that adults and students actually rarely intervene. So one study, and this goes back about 10 years or so, but an observation study that was done in Canada found that fights, and they were talking about physical fights at the time, happened every 6 to 7 minutes on the playground during recess. And actually, let me ask you, what percent of adults on the playground during recess do you think they found stepped in to deal with the problems? So someone take a guess. What percent? I heard 25%? Okay, well, you're very good. Most people start with 50, we go 25, 15, we work our way down to 5. It's actually 4%, so yes. Kids respond, I think it's about 10 to 11% of the time. And when you think about that for a second, that's amazing. Especially since this is physical aggression they were studying. Think about this with relational aggression, which is more subtle, it's harder to read, it sometimes goes across context. So I guess the point I'm making is that these problems are really difficult to deal with. The reasons why people don't intervene, sometimes folks don't think that it needs intervention. It's kids being kids, and they'll work it out themselves. Sometimes people don't feel, adults don't feel they can be effective. So they don't intervene because they're not sure that they can intervene successfully. And many times we know that children who are bystanders, the majority of bystanders actually want to help, but they're not sure how, and they're afraid of being the next victim. And so I think that's sort of why this is such an insidious problem today. My figures are old, but as of about 5 or 6 years ago, it was estimated that aggression and violence within the community costs at least $60 billion a year when you think about juvenile justice facilities and you think about all of the efforts that go in to dealing with the problems that we're here today to talk about. We also know that it's not a developmental stage for most kids or for some kids where they're using aggression. We know that at least for a sizable minority of children, early aggressive behavior leads to more serious forms of aggression, relationship problems, and violence as they get older. So we've been sort of talking around, and I'm going to share with you today some of our cartoons as we get into our interventions, because we use cartoons, videos, and role plays as our teaching modality. So I'm going to share with you some of our cartoons. And what I wanted to start is just by mentioning that I think about 2 types of aggression: the physical and overt aggression, the hitting, the pushing, the shoving, which is generally related to dominance, thought to be most prevalent among boys. And then certainly the relational aggression that Nicki really was the pioneering researcher to help identify this form of aggression and all the problems that it causes. And this is more related to social dominance, to reputations and a manipulation of relationships. We know it's the most prevalent form of aggression among girls, but we know it also occurs and has an impact among boys too. And it includes, as people have mentioned, rumors, social exclusion, and things like that. Just for a moment, I just wanted to reiterate the problems that these forms of aggression cause. First, for physical or overt aggression, we know that this is associated with academic deficits, with social problem-solving difficulties, and we're going to talk a lot about that in terms of interventions, how to help children become better problem solvers. Trouble getting along with friends, and as I mentioned, for some, a trajectory towards more serious physical violence as they get older. And we know that the outcomes for relational aggressors is also not what we would like. They have peer relationship problems, a host of problem-solving deficits, internalizing problems such as depression, loneliness, and anxiety. And we also know that many times, relationally aggressive youth are also physically aggressive, and that compounds the problem even more so. And then research over the last 5 and 10 years has looked at that many of these same children are having later difficulties in their relationships, potentially with mood disorders, and potentially even with personality disorders as they get older. So there's a cost to these behaviors, both for the perpetrator and for the victims. And we know that victims of both forms of aggression many times show symptoms of depression, anxiety, loneliness, and sometimes we see this in terms of school refusal and school avoidance. It certainly affects kids' self-confidence and self-esteem. So the work that I do and a lot of what I'll be sharing with you today is the work that we're doing in Philadelphia. We work in the inner city school settings, in schools that are predominantly, they have children who are predominantly African American. And so I just wanted to share just a slide or two why we feel it's important to work with this population of youth. And I think that one of the reasons is that we really haven't had a great understanding of factors that contribute to aggression among this high-risk group of youth. And by high risk, I mean that many in the settings we're working have both chronic and acute stressors they experience, from poverty, single-parent homes, high levels of community violence, under-resourced schools, racism certainly, lack of positive role models at times. And yet, while some of these children are at increased risk for emotional and behavior problems, the leadership potential among many children and the resilience is quite amazing. So we've chosen to situate a lot of our work within this population, but I think that a lot of the strategies that we're trying are applicable to many different types of settings across the country. About 10 years ago, we reviewed best practices in all the school-based aggression prevention, social skills promotion programs going on across the country. And what we found at that time is that 10 years ago, no one was looking at relational aggression. It was all about the physical or verbal forms of aggression. So even the 5 best practice programs are the ones we reviewed. We're not focusing on relational aggression, and almost all the programs were not as effective for girls, which when you really think about it, since we weren't focusing on the most prevalent and distressing form of aggression among girls, it's not that surprising. We felt like after reading these programs and summarizing, there needed to be a focus on prevention and early intervention. We couldn't necessarily wait to the high school level and be reactive. We had to think about earlier elementary school years and what we could do at those times. Surprisingly, there were very few of the programs that were developed in partnership with the communities that they served. So it was hard to tell whether interventions always would be culturally sensitive as we moved away from kind of suburban into rural populations. And then surprisingly, very few of the programs were designed to be effective or to target the actual behaviors in the unstructured school context where they were most often occurring. So this sort of really influenced the work that we started doing over the last 10 or 15 years. And what I want to do today is share with you sort of 3 lines of research and 3 programs we've developed over the last 10 to 15 years and talk about, what are the strategies that we've learned from these that we think can be helpful in starting to address relational and physical aggression. So I'm going to talk first about a school-wide approach, and specifically called our Playground, Lunchroom, and Youth Success Program, or PLAYS. Secondly, I'll talk about our Friend-to-Friend program, which is a skill-building, problem-solving, and leadership program for relationally aggressive girls. And then I'll talk about how we've adapted this for all children within the classroom as more of a universal prevention program, a classroom-based program for all children, girls and boys. I'll be talking primarily about programs that we've worked with for 3rd, 4th, and 5th graders, though some of our more recent research is with slightly older children as well. So one of the things that I wanted to share is that I think good interventions have to be theoretically driven. And by that I mean they have to be based on good theory. And what we know is that, especially when we're talking about aggression, we have to address this in a very comprehensive manner. So we base all of our programs in part on the social information processing theory of development and aggression. And this is the idea that all of us, when we make decisions about behavior, that we go through a series of steps where we have goals. We sort of come in with our biological vulnerabilities and capabilities, but then we have goals in each situation. Is it to be dominant? Is it to seek affiliation? We have different social goals, and that combines with how we make sense of the behaviors around us. Do we make what's called a hostile attributional bias? That's the idea that when something occurs, how do we interpret that? Is it someone's being intentional and mean to us? Is it something that was accidental? And things like that. And then, what are the choices that we make? And how do we evaluate those choices? And what we know is that aggressive children are deficient in many of those areas. So all of our programs have to do with teaching aggressive children and children in general strategies for being good detectives, for slowing down, looking at situations, and becoming better problem solvers. And then also, we utilize Bronfenbrenner's sort of developmental ecological systems theory. And this is the idea that it's not enough just to change a kid's problem solving, the way they approach situations, and even their behavior, because it happens in a social context. And that we have to also work within the school system, with other kids, with teachers, and hopefully with parents and communities to be most successful. So in other words, the behavior didn't develop on an individual basis, and we need to work with the child within the context in which the behavior is supported. And then finally, social learning theory in terms of shaping new behaviors, role-playing, and practicing is very important in the programs I'm going to talk about today. Another thing that we feel very strongly about, and I think Nicki mentioned when talking about the work that we do, is what we call participatory action research. Sometimes it's called community-based participatory research, or CBPR. And this is the idea that we can't just take an intervention off the shelf, a program off the shelf, and give it to a community or to a school, but we also have to make sure that it really works and it's responsive to the needs of a particular community, school, and things like that. So the theory behind this is that we have to take good psychological theory, combine that with best practice programs, but then we need to infuse key stakeholder feedback in order to make sure that the program is meeting the needs of the folks that we're working with. This is a process that involves the full partnership where community members, students, teachers help to drive the process so that we know that the resulting programs, the ones we're going to talk about today, are meaningful. It requires that researchers and school staff and community members work together to form trusting relationships so that we can link the research to practice. So everything that I talk about today sort of has this framework in mind. And I guess similar to that is the specific context that we often work in, which is the urban inner city schools that serve students predominantly of African American backgrounds coming from low SES families. Almost all the students are on free and reduced lunches in the schools we work. And at the same time, the pressure, probably very similar here in Minneapolis and the surrounding areas, there's intense pressure to meet AYP, Academic Yearly Progress, in Philadelphia. And that's coupled with all these other problems, and that's part of the pressure that the teachers and the educators face every day. And then also, we've recognized that the playground and lunchroom is a particular setting that both can be a real positive setting for social skills promotion, but can also be a real problem in terms of a breeding ground for different types of aggression if it's not handled right either. So I wanted to briefly talk about our plays program first, and that sort of has 4 elements to that in terms of thinking about the design and layout of the recess yard, how to provide activities and organize games for playground and lunchroom supervisors, to promote active monitoring by the supervisors, and in general, promoting better communication and collaboration among the adult supervisors. And as I mentioned, playground and the recess yard they're really important settings, in part because they're so unstructured, that although we know that a certain amount of rough physical play is actually good for development and for problem solving, we know that too much rough play is not good. And if that's the only type of play and the only behavior on the school playgrounds, that can lead to more physical aggression and more relational aggression. We also know in Philadelphia, at least, that staff who supervise playground and lunchroom settings typically are paraprofessionals, parents and grandparents who receive pretty much minimum wage, very little if any training, and they can have upwards of 150 kids at one time. And what this can lead to is children feeling very unsafe, victimized, and we know that if this type of behavior occurs, that it can lead to problems with kids paying attention and being focused and even academic achievement after recess. And at the same time, it's almost the flip side. We also know that the lunch recess can be an enjoyable time to promote physical and social competence, and it can be an opportunity for the adults to be social skills coaches as opposed to folks who give out punishments and feel like disciplinarians. And then research has shown is when this is done right, it actually is related to much better attention from children after recess and academic achievement over the course of 3 and 6 months. So when we've done this program, what are the steps we go through? The first step is we conduct a needs assessment, which is essentially talking with folks at the school, having different folks fill out interviews. We have regular meetings with each of the different groups at the school, with the teachers, with the playground lunchroom supervisors, with the administrators, and with the parent groups whenever possible. I bolded create structured lunchroom program and design an interactive playground because that's what I'm going to focus on in the next few minutes. But keep in mind that when we do this, we also are doing this in the context of conducting assemblies. And conducting assemblies, attending back to school nights, homeschool association meetings, because it's not just doing different strategies, it's the way it's communicated, it's the way it's supported, so that we're helping school principals empower different folks at the school so that they can be most effective in supporting children's social skills development. So the purpose of the needs assessment is really to determine a school's strengths and weaknesses, to learn about the past strategies, to identify, the key folks to work with, and outline a game plan. And this is really important. We have heard some really interesting stories. We've heard stories where we've described the kind of work that we do in terms of creating a structured play yard, where we've had people in meetings raise their hand and say, "Oh, that doesn't work here." And we've said, "Okay, tell me about it." And it's amazing sometimes what you hear when we take a step back and we listen. So I'm going to share with you one of the first schools we were at. This goes back 10 or 12 years ago, when we came in and we were partnering with them, and they said, "No, socialized recess," which was the big term in Philadelphia 10 years ago, "it doesn't work." So I said, "Well, explain to me what you mean by that." And they said, "Well, 2 years ago, we divided our playground into 8 different sections, Okay, so already there's a problem because there's usually only 4 playground and lunchroom supervisors. But we were listening. 8 different sections. Every section was color-coded. Now, the playgrounds in Philadelphia are generally blacktops. There's no activities, so we have to be very creative. So they were color-coding and designating different areas. And then they had different, I forget what the term is, but they had like almost like little bookmarks that had different colors that were associated with each of the 8 different places on the playground. So a place to play dodgeball, a place for quiet games, a place to shoot baskets, whatever it was. Then they instructed the teachers that each day they had to hand out these different groups of 8 bookmarks to different kids. Kids had to then come to the recess yard. They had to turn in. They had to stay within their, section. How long do you think that lasted? Right. The best estimate was 3 days. Right? So there you have actually some good ideas, but getting way too complicated. Yet, had we not listened and really enforced that you had some really great ideas, but it got too complicated, we may not have gotten past that point. That's one of the reasons I think it's really important, to think about and to talk with folks about what they're doing. So instead, as we'll talk about in just a moment, helping the school to divide into 3 or 4 areas that make sense, that people want to supervise, working with administrators to give staff the ability to choose what area they want to supervise, whether they want to supervise an activity with kids, and things like that. All of these pieces are really important. Once the pressure was taken a little bit off the teachers, it seemed to work a lot better. The other idea, too, being that, why should a kid have to stay in one spot? I don't think we would want to do the same thing every single day for an hour. So to make things fun and encouraging, and then allow the kids to go from activity to activity with the idea, let's just keep them busy, let's keep them engaged. So when we talk about a structured lunchroom program, the kinds of things that we're generally thinking about is establishing and posting rules. And this is really important because let me ask, how many rules do you think there are in lunchrooms in your schools? Like how many number? 3 rules, 5 rules, 8 rules? What do you think? 10 rules, I heard? 3 or 4? Okay, so probably is a range, 3 or 4 to 10. How are they framed? Are they positively framed? Like we're going to respect all, include others? In the schools that we work in, it's usually don't do this. This is not allowed. Don't do that. And when you think about that, and many times it's don't do this and don't do that in the same rule. It gets really complicated. So one of the first things is having just a few rules where they're posted, where they can be reinforced, and where they can be remembered and taught. Sometimes, and we see this sometimes in classrooms, where there may be too many rules. So short and sweet and positively framed. We also help schools to establish incentive systems, little things. And sometimes it's just using praise, catching kids being good. Other times it's been to set up lunchroom incentive systems, where training lunchroom and playground supervisors to do almost like a little behavior plan with the class, having the class of the week based on this. It's amazing what sometimes kids really get into that when the positive behaviors are reinforced, and then where some of their classmates are helping to reinforce those behaviors. Certainly timeout or consequence systems are important to clarify. We often spend a lot of time clarifying routines, as well as establishing indoor activities for rainy days, or maybe in Minnesota for snowy days. And I think, But I think one of the most important pieces of this is really trying to get the buy-in of the whole staff and of the kids. Because what what we want to do is think about how do we develop systems and structure and better relationships. And that's kind of what's underlying a lot of these strategies. For the recess yard, we talk about establishing rules and routines, potentially dividing the playground into sections. Again, not going crazy with it, but 4 or 5 different sections. And what we realized is, sometimes playground and lunchroom supervisors or teachers who are helping out in the settings, an administrator could assign someone to a setting for dodgeball. But if that adult doesn't like dodgeball, or is not the way they want to engage with the children, that's not going to be as effective. So really trying to give a voice when possible and thinking about ways that each section of the playground can have a positive, that the adult there can really engage kids in a positive way. Our program provided live training and modeling. So that's the idea that we would come out, and once a week we would hang out during the lunch recess. We would talk with the playground and lunchroom supervisors prior to the lunch recess. We would be with them during lunch recess, and then we would leave. Our philosophy was we would not do the lunch recess. And I think that's a very important philosophy, because what we're talking about today is, I think, building the structure and the capacity of schools to deal with these types of problems around relational aggression and physical aggression. So sometimes programs can come in and they can run activities in the recess yard, and that's great, but that doesn't really help build the capacity. So our philosophy is that we can do things in partnership with school staff, but not for school staff. And I think that's an important sort of philosophy. Sometimes different caught being good systems where, we're catching kids, doing a good job, exhibiting the appropriate behaviors can be really important. So what I wanted to do is actually just share with you quickly the results of a study before we go on and talk more about our intervention specifically related to relational aggression. So in one of our schools in Philadelphia, we provided consultation similar to what we've been talking about so far today about how the playground and lunchroom supervisors could communicate better with the children, with the students, and the teachers to clarify routines for the lunch recess and activities for youth to participate in. And it was a really interesting process because the school staff asked us, how can we find out if this is working? How cool is that? We as researchers often go in and we want to do our research, and we want to make sure it meets a need, but the community was saying, we think this works, what we've worked on. How can we find out for sure? So we actually devised a study together to come back the next year and actually to observe the playground and lunchroom. We weren't providing consultation anymore to the school. And what we looked at was the 2 main areas that we had focused our consultation on, which was the staff providing organized games in different sections of the playground and active adult supervision, which we defined as adults not standing in one spot, but walking around a section and or interacting with at least 1 or 2 children. And what we looked at is the times that when this occurred versus the times that it didn't occur to see whether that made a difference. And we found some whopping differences, as you can see here. At times when they were providing organized activities, and this isn't activities for everyone, this just meant they had an activity within the section of the playground that we were looking at. And these are big, huge playgrounds. But when there was an activity in a section of the playground, children were 3 times as likely to be involved in cooperative play. They were half as likely to be involved in rough physical play. And what we know from research is that we think about 10 to 15% of the interactions on the playground during recess should be and could be rough physical play. So it really cut the physical play down to what I would call the normal levels that you would want to see. And it also, this was a school that had children from 3 different ethnic backgrounds, and they were concerned about how the kids were playing together. And what we found is that children with different backgrounds, when an organized game was present, were playing together 13% more of the time. But when there was an active adult supervising, again, maybe just talking with 1 or 2 children or just walking around the perimeter of their section, there was a 20% increase in children of different backgrounds playing together. When you combined organized games and active adult monitoring, the numbers went even further up. And it just gave us a good indication that when these types of strategies are happening, it really does cut down on the levels of aggressive behavior problems. We've used the ratio of rough physical play to cooperative play as a proxy for aggression in other studies. So we're pretty confident that by improving cooperative play and decreasing rough physical play, that's really, that's moving in the directions that we're interested in. And I did include on the handout, if you want to read more about these 2 studies or about these studies, these are 2 studies that are available. They should be easy to find, or we're happy to email to anyone who would be interested. But next, what I want to do is I want to shift a little bit and move from the playground lunchroom context to thinking about group interventions and strategies that's more at the child level, in the child and then classroom level. And so I want to tell you about our Friend-to-Friend program. And we're very excited about this program, and I guess we're biased, we really like it. And we're going to tell you the reasons why we like it, and how we developed it, and what the strategies are. So first, as I mentioned, when you do participatory action research, it's a combination of good theories and prior empirically supported programs that have been adapted through key stakeholder feedback. So we started with 2 programs that we identified in 2001 that were 2 of the 5 best practice programs. These are some of the earlier references, but these are programs that are very well respected and are currently being run in many classrooms and school districts around the country. The Anger Coping Program and the Brain Power Program. We chose these programs because, again, there was no program at the time, in around 2000, 2001, focusing on relational aggression. But we still chose these programs because they were social cognitive problem-solving programs. They were school-based and had a group intervention component, which is where we were going to start, and they seemed to be highly promising for urban African-American physically aggressive boys. So we used this as the starting point. And what we did is we actually spent about 2 years working with different stakeholder groups of students. We had our Playground and Lunchroom Planning Committee. That sounds real official, doesn't it? Our Playground and Lunchroom Planning Committee was a group of 6 4th grade girls who we had lunch with each week, who said, you want to see what aggression looks like and the dynamics, hang with us. We'll talk to you about it. We'll take you out to the playground during recess, and we'll show you what these dynamics look like, what the behaviors look like, and, you know, we'll teach you a little bit about this. At the same time, and I should say that was invaluable. At the same time, we partnered with two teachers in particular, 2 educators, both of whom had a lot of experience working in the school system and working with children and they were from different schools. And we developed the curriculum in partnership with them, with the goal of making something that would be engaging and fun for the kids, but also would be in their own language and something that would be on the right developmental level and also culturally responsive. At the same time, we started partnering with several parents to form advisory groups and attending back to school nights and talking with parents about the programs. And we also did a lot of work with playground and lunchroom supervisors. As part of the work I mentioned with our PLAYS program, we were working in 5 different schools at that time, and that allowed us to really have access to and to learn from the playground and lunchroom supervisors, not just what the aggression looked like, but the problems that had often occurred during the school lunch and recess periods. So our friend-to-friend intervention program, what does it look like? So essentially, we have groups, and they've ranged probably anywhere from about 6 to 12 girls, but typically we'd recommend about 8 to 10 girls. They're girls who are both high risk, and by high risk I mean who are demonstrating significant behaviors of relational aggression. I'm not going to get into the details of how they're selected today, but I'm happy to talk afterwards. We use peer nominations, which is a technique to get the children's impressions of their peers in their classrooms. We also use some teacher rating scales as well. But from using these techniques, we identify girls who are high in relational aggression, as well as some girls who are not, who are pro-social role models, with the belief that we have to come together as a community to change these behaviors, and that it's important to always have mixed groups. So we do that. These are groups for girls I'm talking about, and we train graduate students in Philadelphia, and we have graduate students in psychology, clinical, school, as well as in different social work and related programs. And then we partner with teachers and teachers' assistants to run the programs. The programs are run during lunch recess. And one of the unique features, and I'm going to actually show you, I think in the handout, it has one page that illustrates the wrong word, that lists the strategies we use. I'm going to show you the corresponding cartoons so that you have a sense of exactly what this looks like in just a moment. But there's a 20-session group intervention that meets twice a week during the lunch recess. Once we are about 12 sessions through the 20, the girls actually go back to the classroom with our team, and they actually become the co-leaders in their classroom to teach 10 classroom sessions of the program within the classroom. And we do this for a number of reasons. One is that the teachers have asked us to do this, that relational aggression is not just a problem for girls, it can affect boys, and it can affect, as we all know, the whole school environment. So on one hand, they wanted us to come back to the classroom so that we could also utilize this program with all the kids, so everyone would get a part of the program. The other thing is that our research and others have found that children who are relationally aggressive, they have a lot of peer relationship problems and all the other difficulties we mentioned. At the same time, some of these children are perceived as quite popular. Many of these children are very influential. And we're finding many of these kids have the potential to be leaders. Now, I didn't say leaders in the right way, but leaders. So by having classroom sessions where we're reinforcing the skills, the problem-solving skills they're learning, it's hopefully helping them to demonstrate leadership skills in a positive way, which I think is another really important factor of why we go back to the classroom. We also use modalities for everything we do of cartoons, videos, and role plays. Our cartoons are cartoon handouts and cartoon homework, which kids love. So it's not really homework. It's more activities. Okay. So I'm gonna walk you through some of our cartoons and how we teach and what we think about. So we start our programs generally by saying, this is our cartoon detective. And we know that there's all kinds of problems that go on around us all the time, but often we don't pay attention until they've already happened or till we're in the middle of a conflict. And so we use the detective girl as an analogy to say that we have to be a detective. We have to pick up on the cues early so that we can better understand and recognize when a problem's about to happen so that we can learn ways of dealing with it. So then we talk about different types of friendship-making problems. And one of the first things we learned when we worked with the kids, all of us understand what relational aggression is. We're comfortable with the term. The kids didn't understand relational aggression, the term relational. So we've broke it down to social aggression when we talk with the girls. What we mean is relational aggression, but this is the way they understand it, by using this phrase. But what we're talking about is social friendship-making problems or relational aggression. And this is the gossiping, this is the leaving others out, this is the threatening to withdraw friendships. There's also the physical and the verbal. And we break it into these three categories just to make it really easy for kids to understand. So there are a few things that you may notice about this. The first thing is that we talk about friendship-making problems. We focus on the positives. We don't talk about the aggression. We talk about friendship-making problems that we all can learn from and work with. We also make the point to the kids that it doesn't matter to us if they correctly identify whether something's verbal or social. Just the fact we want them to know it's not just physical that hurts. It's these relational forms as well. We then use what's called, and the kids came up with these acronyms, we did not, but FBI self. Paying attention to our own face and body to learn how we're feeling. So one of the first steps in the social problem solving or social information problem solving model is to learn how we're feeling, our own signs of physiological aggression. And we do that by paying attention and cueing in to what our face and body look like. And I'm going to come back to the eye, because everybody always asks, well, you've explained face and body, what's the eye for? So I'm going to come back to the eye in just a few moments. But we use our F and our B, our face and body skills, to recognize if we're in a situation, to identify it. Here's a social situation, and my face is starting to get tight. My body may be tense. I'm starting to experience a feeling. We then teach them about CIA, cool it before action strategies. Again, the kids came up with these. And these strategies have to do with things like taking 10 deep breaths slowly, counting to 10. Of course, many of the kids we work with count to 10 like this. 1, 2, 3, 4, 5, 6, 7, 8, 10. So we have to actually show them what we mean. 1, 2, etc. But slowing ourselves down, we talk about visual imagery. The idea just being that if we can identify a possible situation and our physiological signs in response to that, then we can actually use our next strategy, FBI other, paying attention to other people's face and body, and the eye is other information in the social environment to determine why something happened. So we know that aggressive children tend to make a hostile attributional bias. That is, when something negative happens to them, a note's being passed and kids are laughing, they're going to be more likely to think that that note's about them, even if we're not sure. Same thing, they get bumped from behind in the hallway. Is it because there's a lot going on and the bell rang, which might explain that? They're more likely, if they're not sure why, to think it was done on purpose. So we teach them to be good detectives and to use their FBI other skills to determine why something happened. And so just as an example, one of the first things we teach the kids is when things are an accident. So this is an example. The girl in green is walking down the hallway and the school bell rings. And she's thinking, oh no, the bell rang and I'm late. And her head is turned to the side. And she bumps the girl in blue and says, oops, sorry. So there's a lot of face, body, and information clues as to why this is likely an accident, even though the girl in blue got knocked over. And that is that her body, her face is turned, her body is not tense, her hands are not up like she's going to hit or push, and then she says sorry. Doesn't appear that that's sarcastic. We go with, what it looks like. That's likely an accident. Another situation that's more intentional or potentially intentional has to do with jump roping. And one of the things we've learned in Philadelphia is that an invasion of personal space is generally thought to be intentional. So that in this situation where the girl in green is coming up on others jumping rope, and there doesn't appear to be another reason as to why she can't join, that this may be more intentional. We say that because of the body clue, the hand being up, the facial sort of grimace or looking angry, as well as there doesn't seem to be other information to interpret in this situation. However, regardless, we teach the kids that 80 to 90% of the time, it's not as clear cut as the two examples that I just showed you. Most of the time, it's in between. And that's often where problems happen. And so we have the AAA strategy, this assume an accident strategy. And that's the idea that unless we're 100% sure something was done on purpose, we're going to assume it was an accident until we get more information. And if we do that, that can avoid a lot of problems. Once we do that, that really leads to our choices. And what we try to tell the kids is that you always have choices. You may not make the best choice, but we want them to know they have choices and to think them through. And then putting this all together, this is an example of kind of, it may be a little tough to see, but this sequential social problem solving model. So in the first box, what type of friendship making problem is this? So we have them identify that this may be a social and or a verbal social information processing, a social friendship making problem. Then by FBI self, we have them circle the face that would be most likely to be their physiological reaction, as well as inside and outside body clues. Inside body clues being the heart beating fast, butterflies in the stomach, outside be feeling shaky, tense, or sweaty. And then to think about, in the third box, what CIA strategy they would use. And then fourth, to look at the situation more clearly, to see if they think it was done on purpose or not, could they assume an accident, what would be some choices, and then what would be their potential plan that they would have, and how would they evaluate it? What are the good things that might happen, and what are the negative things? Because what we want kids to do, even if they decide to be aggressive, which we hope they don't, at least think it through, think about the context, and be a problem solver, be a good detective. And then our thought is if they go through that series of steps, they're much more likely to, one, either realize that it wasn't intentional or to find a better solution than just reacting to the situation. We also help girls learn how to apply this problem-solving strategy to rumors or gossip, as well as to entering groups on the playground. And this is an interesting one. So the research shows that there's certain techniques when you join a group on the playground during recess that are likely to be more successful and some that are less successful. Interestingly enough, no matter what kids do, sometimes they get into the group, sometimes they don't, even if they use the worst strategy, and even if they may be not liked by the group. And the same thing happens with, they may be relatively good friends with folks in the group, they may use the best strategies, and some days it might not work. However, the majority of the time, using strategies like we teach them, like wall, and what I'll show you is tag. So wall is wait and look and listen. This is the idea that when you approach a group, you can't just barge in, that you have to sort of wait. So the girl in green is thinking to herself, I should say, I should wait, look, and listen. They're in the middle of the game, right? None of us like to be interrupted. And then tag, talk about the game. And that is when it's the right time, such as when there's a change in the game, in this case where the jump rope was missed, to then make a comment that's about the game. Not, let's do this, or I want to do that, but instead, looks like fun. Do you need another person? So again, it's being a better detective of the situation. And the other thing we teach the kids, think about, is this a group you really want to join? If it's a group that has a lot of children who don't tend to be nice to that kid, that's probably not the best group to try to join to even start with. The other piece I just wanted to mention briefly is that we've talked some about the design of the program. In terms of the implementation of the program, we train graduate students, and the graduate students briefly train teachers in 3 to 4 meetings over lunch about the program so that they can assist with the program and with classroom sessions. And their main role is to cue the youth to use the strategies, to help with any behavior management problems, and actually even more so, I think, just to bring it to life. So if we're talking about using a strategy, many times the teacher has seen a situation that's occurred within the past few days that the kids can relate to. And I think that's one of the really most important aspects. We also partnered with community members, and we had 2 or 3 main community partners. One was the school secretary at one of the schools. The other was a person who, I'm not sure what her official title was. One year it was a classroom assistant. One, it was a homeschool liaison assistant. So these were both people who knew a lot about behavior in the school. If you ever want to find out what behavior is really like, talk to the school secretary, we found. But they both partnered with us and went over our curriculum. And then, really interesting, we invited them to sit in on sessions and to give us feedback and give our team as well as our facilitators feedback on, cultural sensitivity, on how we were engaging kids, and how to make suggestions for how we could better work with teachers and families. We found that to be absolutely invaluable. So switching to the research side, just to show you a little bit about what some of the results in terms of using this program. So our initial trial of our friend-to-friend program, we were working, we developed the program in 3 or 4 schools, and then we did a trial in 2 urban schools. Again, I'm not going to get into a lot of the details, but we use primarily peer nominations as a way, as is often done, to better understand which children were having problems with relational aggression. Children who were having sort of moderate levels of problems with relational aggression were identified, and then classrooms that had multiple girls with relational aggression in them were selected for this study. And so 11 of the 18 classrooms had more than one girl with relational aggression, and those 11 classrooms had, I believe, 49 relational aggressors in them. We randomly assigned some of the classrooms to our friend-to-friend and the others to a control condition, which was a referral to the school counselor and sort of as needed for sort of the traditional school services. One of our control classrooms, 2 of the 3 girls actually moved as we were starting, which is why the numbers are a little bit unbalanced in this initial trial. But those were the only kids who dropped out. So all the kids who started the program actually finished the program. And so the 32 girls were comprised of 3rd, 4th, and 5th graders. We videotaped each session. We don't videotape anymore, but we do live observations. But we videotape for integrity monitoring. And that was to make sure that the core content areas of the intervention sessions were being followed, as well as the areas that our community partners had told us are really important for engagement, for alliance with the children, for behavior management. And as you can see in the bold, we thought we did pretty well. 86% of the key content areas were fully implemented. And 96% of the process areas were fully implemented or were implemented at what we considered an acceptable level. And then we also looked at our inter-rater reliability, which means that we were able to determine that different observers saw the same thing over time. So what I wanted to do is to present briefly just some of the results. This is our results on an acceptability measure. And on a scale from 1 to 4, 1 being highly unacceptable, 4 being highly acceptable. As you can see from this, both students and teachers found the program to be very acceptable. In terms of the actual behavior, so we have here treated girls that we worked with through our friend-to-friend program versus untreated relational aggressive girls, similar girls that were referred to the school counselor, and these are teacher ratings of behavior, and these represent, the bars represent how they change over the course of the year. So the blue are the kids we've worked with, and what you see is a pretty nice size reduction in relational as well as physical aggression in the girls we worked with. Those are the blue sort of bars decreasing, whereas the other girls stayed at the same high level in terms of relational and physical aggression throughout the year. Then, and very interesting, we saw that the kids we worked with were becoming much better well-liked by their peers. The kids we didn't work with were actually had just the opposite pattern, which I think speaks to some of these behaviors over time and the impact they can make in the school environment. And then we also have a measure that we adapted one of Nicki's measures to cartoons for our population of girls. And it's a problem-solving measure. And what we found on this measure, that the girls we worked with had a 12% reduction in their likelihood to make hostile attributions. And that is huge when we talk with teachers. So 12% of the time, they're not getting involved potentially in anything beyond, well, that was an accident. I can walk away from that. Kids we didn't work with, their attributions remained high and the same throughout the school year. So conclusions that we drew from this study is that this model for working intensively with the community can be a very effective way to develop sensitive and responsive programs, that this is one of the first empirically supported programs on relational aggression. And as was mentioned earlier, you pick up the paper and you hear about all these programs that are addressing, the mean girl phenomena, but up until the last few years, there are no programs that were really studied systematically. And this was our first study, and I'll share with you the other studies that we're running, because it's really important that we make sure that these programs work before we disseminate and recommend them to others. So again, I think this is an acceptable and feasible program to implement, and it had the potential to decrease levels of aggression, hostile attributions. I didn't present due to time, but we also had decreases in student reports of their own loneliness, which is another, I think, very important finding. So we also have 2 articles, actually 1 book chapter on how we developed this program through partnership, as well as a study that an article that details the study and what I presented today. And then what we've been doing really the last 4 or 5 years, and we'll be able to look at new data within the next year, is we've been conducting a larger clinical trial of the program, not across 1 or 2 schools, but across 6 schools, 6 large urban elementary schools, across a much wider range of outcome measures, where we're getting teacher, student, parent report, looking at what the behavior looks like itself through observations on the playground during recess. And probably most importantly, we're not comparing it to a referral to the school counselor, but that we're actually providing another intervention so that all children who are identified receive some services. And half of the children are receiving what we call our homework study skills and organization group. Because one of the things that we found in our research and others have found is that kids who are relationally aggressive are more likely to have academic deficits as well. So instead of not providing an intervention, we wanted to provide another intervention so that we can see whether our program is really effective when another program with the same level of intensity is being run in the school. So we developed this homework and study skills program that I would say, well, I was going to say teachers are equally excited about, but that may not be true. It depends on who the teacher is. We have some counselors and teachers who are more excited about one program than the other, but it's nice because we provide services really to all kids who need it across these 6 schools. And we're also going to be looking for the first time, it's actually a 1-year follow-up. So not only how are they doing when the program's done, but does that maintain through the use of some limited booster sessions the next year. The other work that we've been doing and have conducted some studies on over the last few years was we listened to the teachers when they said, this is great for girls, but we need this for everyone, and we need it in the classroom. So we wrote another grant, and we were fortunate to receive it, where we developed our PRAISE program, which stands for Preventing Relational Aggression in Schools Every Day. And the idea being that relational aggression is a problem for boys as well as girls, and it's also persistent across time and settings. And so we decided that we really wanted to bring the program to the classroom, but if we were going to do that, we actually needed to make some changes, or really some additions, I should say. So what we did is we used the social cognitive problem-solving techniques, everything that I've shared with you so far today, and we collapsed it a little bit, down from 20 sessions to about 11 or 12. But then we added 8 sessions related to empathy awareness, perspective taking, and what to do if you're the bystander of aggression. And these are common elements of some of the bullying prevention programs that we thought if we were going to do this at the classroom level, it would be important to add. I'm not going to go into the detail, but we also use partnerships to adapt these portions of the program, and then we ran focus groups for the first year or 2 that we developed our PRAISE program, so that we would have our intervention session one day, and then we would alternate each week, meeting with a group of girls and then with a group of boys. And we did this at 2 different schools and different grade levels, just to get their impressions of the program and what could be adapted to make sure that it would be effective for boys and for girls. So the way this program has worked is we have 2 to 3 trained graduate students. It's set up as a program that's run for 10 weeks, twice a week for 10 weeks. We had agreement to integrate this within the curriculum, and I believe that it substituted for the health curriculum, so that we were also trying to meet a need of the schools as opposed to adding more work for the teachers. Again, we use cartoons, videos, and role plays, and as I mentioned, we used extensive partnership to try to make sure that it would be appropriate for everyone. So I'm going to share with you a few more cartoons. So how many people have heard, I think it's the true story of the big bad wolf? People? Raise your hand if you've heard that. Okay. It's hard to tell, maybe about a quarter of us. All right, so this is the story where the big bad wolf is misperceived. The poor big bad wolf is misperceived, and there's a whole alternative explanation as to why he blew the houses down, the 3 little pigs. And that if we hear this story, we actually may have more empathy for the big bad wolf. And I believe this story occurs, if I'm remembering correctly, that this is at the trial of the big bad wolf. So this is the big bad wolf's defense. And what we do is we tell the story to the kids, which they really like. And it has to do with the fact that the big bad wolf had a very bad cold on the day that he went to the little pig's house. And so the huffing and the puffing really had more to do with the cold that he had. And that, you know, he couldn't control himself. He kept sneezing, and I'm not sure how he explains the fact of eating the pigs. That's another story that I've never found that fully explained, but we don't talk with the kids about that. Anyway, but you have an alternative explanation that actually, when you really think about it, makes you feel like the wolf was also having a pretty bad day. And we use this as an intro exercise, as a fun way of thinking that sometimes we can be empathic and sympathetic to others, even if we don't share their perspective, and even if we maybe see them in a different light. We then talk about perspective taking. And I'm going to share with you one of my favorite techniques that we use. And this is the two-sided vase. And what happens is that we get the whole classroom in on the activity except for 2 kids who we pull out, they volunteer. And then what happens is they come, if we pretended this was a table and they had chairs on either side of the table, we have a vase that's covered so they can't see it, and they sit down. And from one perspective, that vase looks all red. From the other perspective, it looks all blue. Or maybe I reversed that. But anyway, from one side, it's clear it's a red vase. From the other, it's a blue vase. And what we do, and we usually have either candy or pencils or something fun at the top of the vase. And if the kids, the 2 kids, can agree to what this looks like, then everybody gets a little reward, a little prize. The only caveat is that the audience can't give it away. But if they have trouble, they can make certain suggestions to help them problem solve. And there's a great analogy for problem solving. And what happens is it starts with, well, it's a blue vase. No, it's a red vase. Are you crazy? It's red, it's blue. And sometimes they may come up with it themselves that maybe they should switch seats. Often that doesn't happen, and someone in the audience will pose a question, you know, what do you think it would look like if you were sitting on that side? Someone else will say, why don't you try and change sides? And so obviously they come up with the idea that it's both red, it's both blue, but depending on how you see it, where you sit, even your angle, it's going to look different. And we use that as a problem-solving analogy. And I must admit, the first time that we tried something like this, one of our graduate students recommended this and heard of this, and I said, I can't see this working. I can't see, you know, that we're going to make this work. And I'm going to share with you what happened the first time, because it was really unique in many ways. So we're in the classroom, we're trying this out, and one of the volunteers, you know, the 2 volunteers, we go through the exercise works, and then we say, can we have 2 other volunteers who have a problem, who want to come, you know, and have us help you to sit in the other's seat over time and gain their perspective and work this out. So one kid raises his hand, and he says, yeah, I got a real problem. Comes down. We say, okay, well, you didn't, who else? My teacher. He called out the teacher. And I'm thinking, we're in real trouble now. And the teacher, to her credit, said, okay, we have some issues to discuss. I'm in. And the teacher came down. It was really unique. And what happened was that when it was the kid's turn, he said, I came in today, and I know I've been in trouble a lot, but I decided I'm going to have a good day. And and this is what I did to try to do that. And then I dropped my pencil, and someone laughed, and, the teacher turned around, I'm grabbing my pencil, and all of a sudden I'm back in trouble, and I'm really, really angry because I did a good job for the first hour, and I really tried. And that teacher shared the perspective that every single day it seems like there's a problem from this child. But they were able to actually understand and change seats and come to a better understanding. And I mean, it's an interesting problem-solving strategy. But you have to have people who are willing to really to work at it. Luckily, that first time worked out. I was able to see I was wrong, that actually is a technique that can work, and that you can apply a lot of the problem-solving strategies that we've already talked about to this type of a situation. And then finally, the other thing that we add, essentially to the friend-to-friend program, in addition to empathy, awareness, and perspective taking, is around the bystanders of aggression. What to do if you're the bystander. And this cartoon illustrates that, in this case, there are 2 boys, one being physical, the boy in blue, to another child, and everybody, including the adult, is watching. And so part of this also recognizes that it's tough to be a bystander, to know what to do, tough for adults, tough to kids, but we have to address it, and that has to be part of the solution. And so that's part of what we sort of brought in as part of this curriculum. So what I want to do is just to share with you our preliminary study of this program, and then to talk more about what are the strategies to take away from this. So again, we developed this program by working for working 3 or 4 years in 2 different schools, and then we worked in an extremely large school where we tried out this program. Where, again, we determined essentially how many aggressive children, both relational and physically aggressive children, were in each classroom in the 3rd and 4th grade, so that we could randomize and get a sense that we were working with a group that was somewhat equivalent to the other group that we weren't going to work with. And again, we were going to refer to the school counselor and provide some consultation as needed. I'm not going to get into our measures due to time, but we used a lot of well-known measures as well as 1 or 2 newer measures that we validated and published on. And again, I'm happy, I've provided the citation. I'm happy to talk with anyone who's interested in the specific measures later today. But essentially what we found, first we looked at student acceptability. And essentially it was pretty acceptable to everybody. So again, a 1 to 4 scale with the averages around 3.3, which when you work in the schools and you're providing a curriculum, substituting for help, that's pretty good, I think. So the kids liked it. And it actually didn't matter if it was aggressive girls, aggressive boys, all the girls, all the boys. Everybody seemed to like it. And there were no differences, significant differences between the groups. Probably more importantly, well, I shouldn't say more important, equally important, were what did the teachers think? And we asked the teachers, we developed a measure to look at 3 different perceptions that teachers might have. First, we asked them, what do you think about the kids' acceptability? How much do the kids enjoy this? How much do they like it? How engaging did they think it is? And that was a 3.6 on a scale from 1 to 4. Very, very acceptable. We asked the teachers how much they liked it, and that mirrored what the kids said. It was a 3.3, again, very acceptable. Then we asked a lot of questions about feasibility. How much of an interruption did this cause in your day? How much paperwork did we give you? Were you able to transition back to what you were doing before? Things like that. And what we found is that it was pretty feasible, what I would call reasonably feasible. So a score of 3.03, which is equivalent to a rating of feasible. And we were really excited about that because we had come in and we'd been in the classroom 20 different times, plus 1 time before to do measures and 1 time after, and that's a lot. So we thought that was very encouraging. Then I'm going to share with you quickly a few of our main findings. So the first thing we wanted to look at is, does this program work for aggressive girls? Because we know that our other program, more intensive program with groups, seemed to work with relationally aggressive girls. And what we found is similar promising findings with aggressive girls, even when they were not targeted in any way as part of this classroom-based initiative. So their knowledge of social problem solving and anger management techniques increased on our measure substantially compared to aggressive girls in other classrooms. And then we found what I would call huge aggression suppression effects, both for relational aggression in this slide and the next slide in terms of overt aggression or physical aggression. So we didn't do a lot of decreasing aggression through this classroom-based prevention, but we had an incredible effect for preventing it from going up. So the kids we didn't work with, their levels of relational and physical aggression, according to the teacher report measures, skyrocketed over the course of the year. The kids we worked with, it stayed the same or went down a little bit. Again, this is a small sample and very preliminary, but it was very encouraging that we were finding pretty similar things for aggressive girls. We also looked at all girls, and we found very similar patterns of results. Their knowledge improved, and their levels of relational aggression were suppressed. Boys did not find as much for boys. We found that their knowledge improved, but it did not translate into any kind of behavior effect or aggression suppression effect. And we think there's a number of reasons for that, which is funny because it has to do with a lot of the strategies that we're going to talk about today. And we've just written a grant to integrate these strategies because we believe that that'll make the program effective for girls and for boys. And by that, I mean, I think that the boys needed some more coaching around the activities, especially around the physical and the relational aggression that occur during the recess time, as well as we found the teachers wanting more training in terms of how to handle these situations. So we had focused more on the kids, and we talked with the teachers about it and partnered with them, but we didn't really provide as much instruction to the teachers. So in the grant that we wrote, and hopefully we'll get and be running in the future, it'll actually look at this program in the context of actually providing what we talked about in the beginning, some playground and lunchroom consultation and teacher consultation. Because again, everybody seemed to like the program, thought it was acceptable and feasible, and it had some really promising results for all the kids, and especially for the girls. And if people would like to read about our write-ups of these, our main study was published in the fall in 2010 is the one on top. And then a second study that we talk a little bit more about how we developed ways of looking at how well the program was implemented, but also describes the program, was published the year before in 2009. And then I did want to mention, if people haven't seen, I guess it was over the winter, really. Nicki and I were the guest editors for the first ever special series to be published on interventions related to relational aggression. So I listed an article that we reviewed, the literature in this area specifically relating to interventions, next steps in research and practice, as well as one is our introductory article, and the other has to do with a review of the existing programs that are out there. So what I want to do for the next 15 to 20 minutes is to talk about where do we start? What can we take from these studies, and what are the types of strategies or interventions that might make sense to consider? Because what I've talked about are some pretty intensive interventions that we're still fine-tuning to make sure they work in collecting data. And they're intensive, like many good interventions are. But we've learned a lot, and when we provide consultation to schools and school districts, what are the things that are important? And that I would encourage us to think about as we get into the case examples and maybe even to the breakout sessions later today. So I'm going to talk about 5 main areas in the next 15 minutes. I'm going to talk about ideas and strategies for recognizing the problems and talking with youth about those problems. Thinking about what are the applications related to school-wide strategies. What thoughts do we have for increasing youth social skills and problem-solving abilities? And then really the importance of parent-child communication, good communication. Really at all levels, not just parent-child, but good communication for everyone involved with these issues. And then I do want to mention issues of cyber aggression, which I think are now just being studied, but increasingly are important for us to think about and address within this context. So I guess the first, even before getting to strategies, I just want to talk about what do we think about the signs that children or adolescents that we may think are becoming distressed about aggression. Because it's unfortunate, many times children do not tell, especially with relational aggression. They hold it in. They don't want to be perceived as differently. They're embarrassed. So how can we recognize this? So changes in eating patterns, changes in sleeping patterns, somatic symptoms, school refusal, school avoidance, worsening of academic performance, complaints about changes in relationships with classmates, with friends, or complaints about the lunch recess period. Now, I mention all of these, and I mention them quickly, because none of these by themselves, is going to say a child's having problems with relational aggression or for physical aggression. But I think that if we're seeing these as educators, as parents, as healthcare professionals, it's indicating that something may be going on. And then I think we have to ask the questions and be open to hearing that there is a problem. I think the ones that really stand out is sometimes complaints about recess and lunch, or changes in friendship patterns. To me, those can really stand out. But any of these would require us to really think through and talk with our students and with our children. So just to mention, I sort of alluded to this a minute ago, reasons that children may not tell others when they're having a problem. They may feel embarrassed. They may feel that there's something wrong with them personally, although we know that aggression and bullying comes in all sizes, shapes, and forms, and it affects everyone at times. They may be afraid, and we see this a lot of times in the schools where we work, where sometimes parents overreact and they come to school not in control maybe of their own emotions, and it can make problems worse. And so sometimes we hear kids are afraid that, if someone overreacts or if they're viewed as tattling, that may cause a problem. And then the other thing to consider, some of this aggression and bullying may be working at some level for some of these kids. They may be getting something out of it. And again, that's why we think about how can we help these kids become leaders in a positive way? How can we substitute some of these patterns of behavior, if at all possible? So when we think about advising parents and strategies for parents, one of the things we talk about is just opening up lines of communication. And sometimes this can be really tough at all ages, but certainly at adolescence. But talking about, on a general level, what their friends are like, how they're doing in school, and then asking them how they're getting along with their teacher, and if concerned, making sure that there's good communication with the other adults at school. For parents, better understanding what the children are doing during their free time. Are they on their computer? Are they texting all the time? How are they spending their time? Is it productive? Are they involved in activities or sports? And as a parent, I think about these a lot every day. How do we get our kids to talk about their school day? And sometimes it's not waiting until there's a problem. It's just, how was your day today? What went well? What didn't go well? So establishing those lines of communication are really important for parents and kids. In terms of school-wide strategies, some of these get tricky because most of the schools we work in, there are not school recess programs like we've talked about. So either we have to work with schools to provide it, or many times they don't exist in a systematic, structured way. Now that's one of the levels of intervention, and one of the first ones, which is to work with schools around developing a more structured lunch recess program. And what we know is that can knock down levels of aggression, incredibly so. When I first moved to Philadelphia, and I'd go out and consult in the schools, we would hear about the terms were, the kids were playing suicide or jail. And those were the names of the games they played because they had no activities on the blacktops. And maybe they'd bring a tennis ball, but most of the time, suicide or jail would be a group of them would decide it would be fun to terrorize this kid over here today. They'd surround him, and they'd see how far they could get, and pushing, shoving, beating him up or her up until it was noticed by an adult. Now think about that for a second. Many of these kids are good kids, but we got to give them something positive to do, and we got to communicate that. So one of the first levels working in schools is making sure that there are structured procedures and that playground and lunchrooms are staffed appropriately. But if we're advising kids in general, or I should say in particular, it's really to help them get involved in a structured activity when it's available, to stay close to their good friends. We help kids and schools, administrators, recognize what's a bullying hotspot. So in our schools, not only are there blacktops, but there are large playgrounds, and they go around the building. So you physically cannot see from one end to another. And that means there are alcoves, there's sometimes trailers, because there's not money to build onto the school, so there's trailers, which is fine, except then it cuts off areas of the school playground, which do make bullying more likely to happen. So part of the school-wide strategies is making sure that we as educators know where does bullying tend to come up and occur, and how can we create structured activities and get kids involved in that. It's really important, if a child is being bullied, to establish a point person at the school that they can go to for support or help. And I'm often asked, who should that be? And the answer is, to me, it really depends. It doesn't have to be the principal or the counselor or even the classroom teacher. It really depends on the situation. It could be any of those folks. It could be a playground and lunchroom supervisor, anyone who's going to be supportive of the child, willing to communicate with others at the school and at home, and also is not going to embarrass the child for reporting, so that it can be done at a time that's not going to look like they're telling, and at the same time, be framed in a positive way. Sorry. So in terms of other strategies, avoiding bullying hotspots, that sounds funny or silly, but it's not. We want the kids, just like we're teaching them to be better consumers in terms of which groups they try to join in the playground, it's thinking about and avoiding different hotspots. And I think one of the things, just in terms of education, is helping schools understand that relational aggression probably hurts worse than physical aggression, and I would say at least as much. And so what that means is that we have to be motivated to deal with it, to recognize it, and to appreciate its impact. And I know as we talk through the case studies in a little while, it's important that everybody gets on board with this and takes a whole school approach. Certainly, role-playing with school counselors around some of the problem-solving, perspective-taking, empathy awareness skills can be very important too, if there's not an ongoing program, but that is a way that can be helpful for many of the children. For parents, promoting friendships. My favorite research to quote is the research that shows that the development of one good friend, is the biggest buffer against bullying and victimization. As a parent, if you think about that, or as a teacher, that doesn't mean you have to be friends with everyone. But how do we develop that one friend? As a parent, short, quick outings that are fun, that are highly structured, where there's not time to have a problem. One of the examples we use sometimes is bowling. And the reason I use that, I'm not sure that's the best example, but it's short. You can bowl a frame, it's over, it's highly structured, and you're done with the play date. Helping to have one good friend, especially for younger kids, can go a long way. Having teachers and parents help kids set a friendship-making goal is important. And then one of the things that we find, a lot of the children who are relational victims are also relational aggressors. And when you think about that, many times the kids who are complaining that others aren't treating them nicely, we see them, when others want to come up and do things with them, they're also using social exclusion or rumors. So it's understanding that to be a good friend, having a good friend takes being a good friend. In terms of promoting perspective taking, I think that in the classroom, as well as at home, integrating ideas, using concrete demonstrations, and thinking about teachable moments. So one of the things, we've had all kinds of experiences when we've gone to do our friend-to-friend group where different kids in the friend-to-friend group have decided they're no longer going to be in the friend-to-friend group if, Joanne's in the group. They've all decided that. And they've clarified they're not coming anymore if Joanne's in the group. And they know their rights as research subjects. They can step back. And they're drafting letters from their parents, blah, 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 blah. You got to address those things. And you got to address them when they come up. One of the ways we've addressed it is by calling all the parents, talking with the school counselors and saying, hey, guess what happened today in the group? There was a relational aggressive incident. They said, well, isn't that what the group's about? I say, exactly. Send all the kids back. Give us the support we need so that that's not going to be allowed. We got to change the school culture. And that's an important message. It's a message about problem solving. It's a message about identifying teachable moments. So that means, and we feel strongly, we have a curriculum, but if something comes up that's an example, we've had times where a facilitator was relationally excluded, or there was a rumor started about one of our facilitators that she was having a relationship with one of the young teachers, and it upset her a lot. She didn't want to deal with it, which I understand, but we had to deal with that, and we had to deal with it on multiple levels because otherwise we're supporting this climate that's not going to be effective in these things. So as part of this, it's asking kids, what are you thinking? What are the benefits of seeing both sides? And I guess for me personally, and maybe others here who feel like we're problem solvers, it's easy to try to step in. And in some ways we have to resist that. And we have to validate the feelings. And then we have to praise kids and others for coming to the right solutions over time. That's not the same as accepting the behavior, but it's allowing for the learning process to occur. A lot of times it's asking not just what happened, but it's building the perspective. And what happened before? How did you interpret this? What happened afterwards? And then what did the other person think was happening? And how would you feel if you had their perception? So part of this that we recommend going through, similar to our program, is how to slow down youth by asking questions such as these. What led to the problem? Was there anything that a child did to contribute to the problem? What their choices were? What are the consequences? And then really, as parents, as educators, as health professionals, that we have to remain calm and demonstrate that we're not going to lose our cool. Unfortunately, at dinner last night, I was sharing that we witnessed an event where a teacher lost their cool with a kid, and our team witnessed it last week. When that happens, we're demonstrating just the opposite behaviors, and we have to approach those situations head on, and as a system, learn better ways that we can each take care of ourselves so that we don't get so burnt out and so frustrated by the difficulties these behaviors lead to. We also need to do things like creating a special time with kids each evening, becoming better informed about our children's hobbies and behaviors, and being non-judgmental and a listener. And I'm going to end by talking briefly for a minute or two on cyber aggression. And the reason that I decided to bring this at the end, and we only have a minute or two left, is I think that all the same strategies that we talk about really apply when you talk about cyberbullying. I mean, it's the same kind of thing. We can't ignore it. We can't just walk away. And we can't just turn it on. And if your children are anything like my own children, they know much more about the modalities than I do. So just having them turn it off or even putting up parental controls isn't enough. And what the research is finding, that the number one factor that's influential in this is actually not monitoring, which I still think is important. It's good communication. It's good general communication between kids and their parents to help them understand and make it more human. That there's a cost to doing these behaviors. It hurts someone. So using good problem-solving techniques and perspective takings, how would you feel if this rumor was out about you? It's the same types of techniques and problem-solving abilities that we feel are so important for addressing relational and physical aggression in general. It's not just about turning the computers off, but having computers in an area that can be better monitored, knowing about our children's practices with computers, as well as talking with them about it. Those are good practices as well. So thank you for listening to this talk this morning, and I appreciate being asked to lead us in this discussion today.
All right, thank you all. We'll take a 10-minute break, and we'll start again at about 10 after. welcome back. 10 minutes goes by so fast. It'd be nice to have a good half-hour break to network and move your feet around and visit the restrooms and so on, but we'd miss out on some great opportunities, so I'm going to reconvene us. I'd like to invite our panelists to come up on the stage and join us. Paula. Our first panelist, Paula Hemer. Paula is an early childhood special education lead and the district's lead school psychologist for Stillwater area public schools. Panelists can go up to the. She's also president of the board of directors for the Youth Service Bureau, which is a resource for youth and families dealing with behavior and emotional issues in the Stillwater area. Parents, schools, local law enforcement, courts, and community groups rely on the Youth Service Bureau to keep children and youth out of the court system and in school using highly effective early intervention and prevention strategies. On the far end, welcome to Julie Hertzog. Julie is a director of PACER's National Bullying Prevention Center. And for the past 5 years, the Bullying Prevention Center has been working to educate communities about bullying and to provide tools for children, teens, and parents to prevent bullying. The digital-based interactive education resources are designed to benefit all students. Their site for teens was created and designed by and for teens. And in March, Ms. Hertzog was interviewed on KARE 11 to discuss how students and parents can prevent bullying. On this end, Dr. Crick, and in the middle, Dr. Leff. And I'd like to bring up Peter Ralston, who's going to moderate the case studies and discussions with the panel. Peter is the coordinator for the Crick Social Development Lab and the coordinator for the Center on Relational Aggression at the University of Minnesota. And I was asking him before he came up here what his degree was, and Nicki said he has a Ph.D. from the Crick lab. So we've learned in working with Nicki and the Center on Relational Aggression that Peter is really the key person that makes it all work. He's a tremendous asset. He makes Nicki look good on a regular basis. And us. So welcome, and there's your panel.
Right. Thank you, Joel, and thank you, Nicki. I feel kind of embarrassed because, wow, very kind words. So today what I'd like to do here is read a few scenarios that have been submitted by various people in the audience on situations that they've encountered in their professional lives at school or in the community and whatnot, and give the people on our panel here a chance to respond to some of the issues present in these scenarios. We're probably not going to be able to get through all of them today, but we're going to get through as many as we can in the time allotted. So I'll go ahead and read the first scenario. Now, our panelists have a copy, but I know you in the audience do not. So I'll try to make this accessible to your memory bank. All right, the first one that we're going to talk about. As a teacher, I worked in a school which had a clique of teachers who were very exclusive and ostracized each other teachers and the paraprofessionals. This group did not want to have staff parties that included the paraprofessionals. They would often remark, "When you were a little girl, you didn't get invited to all the birthday parties, did you?" And so one year I had the daughter of the queen bee of this teacher's group in my classroom. The daughter acted just like her mother and formed an elite group of girls to ostracize the other children. In one case, they made fun of another girl who had a knee injury by laughing and imitating her limp. When I mentioned the problem to the mother of this queen bee, she laughed and said it was funny. She thought it was odd that I would even defend the other girl, whom she felt deserved to be picked on. There was no remorse, but rather a sense of entitlement and a feeling of being better than others. So you very clearly are seeing some of the intergenerational things, but also some of the issues that teachers themselves have in their professional environment. So the question that this submitter asks was, how does one change such a pervasive sense of a class system and a group of adults and children who are looking down on others? And so I know this meshes very well with some of the themes that Steve brought up, so perhaps turn it over to the panelists.
I think they could benefit from Stephen's F to F program.
So one of the first thoughts I had is, it's almost like the culture and the climate is off. The idea that not everybody needs to come to all the parties. I mean, that while we may accept that, this is still the school, and everybody has to respect each other and work together. So to me, it sounds like just at a systemic level, there needs to be buy-in for the importance and the understanding that this is really important, and how the adults act is going to be reflected among the students as well as the staff.
And I agree with Steve that a school-wide strategy to change the climate is absolutely essential. It's probably not sufficient in this case. And I guess if this were happening in my school, I would definitely want to focus on the parent initially. And I think Steve, in his presentation, mentioned asking the question, what's the cost of the behavior? And helping the parent understand that using some of those strategies you spoke of, perspective taking, empathy building, problem solving, with both the parent and the student. But I think changing the climate is absolutely essential.
I just wanted to add a comment that isn't really related to intervention, but in my experience, it's very typical for the parents of a relational aggressor to behave in this way, either to engage in the behaviors themselves, or when they see that their daughter or son is doing it and they're confronted by it, to not take it seriously. And research has shown that when parents don't take these behaviors seriously, as you can imagine, these behaviors tend to increase.
I also think that this situation illustrates that oftentimes we see aggression as only being physical. And, it's just historically, it's easy to think about pushing and shoving and to recognize that as a behavior that needs to be addressed. And it's only, in the last decade or so that we're realizing the impact that social aggression has on kids and the impact that it can have on them. And so even kind of just that simple education about, what is aggression and how do you define it, and would really go a long way in this situation.
Another thought I had is that, I absolutely agree. I think there's school level, sort of climate level issues, as well as obviously some work, as you mentioned, with the parents and the child. But I was trying to think about, how do we think about changing that climate? If we think about the message that this case sends, it's pretty pervasive. And so, I started thinking about, would some type of cooperative task, I'm thinking about, from kind of the history of the social psychology literature, but, having people break down barriers, by having, not that we all want more retreats, but but something where, there can be ways that the school staff get to work and partnered with each other around common problems and issues, coupled with a message, I think, from the administrator would be really important about the expectation for having a safe school. Because I think the school would need that for folks then to feel safe to confront what sounds like to be staff members who are relationally aggressive as well.
If I may add to piggybacking on that, and recall a big part of this issue is that the paraprofessionals are being looked down upon by the teachers in the school. And from what Steve was saying earlier, on the playground, it really does come down to the paraprofessionals being the first line of defense, or maybe proactive engagement of the children. And so, any thoughts on if you've had similar experiences where the paraprofessionals haven't been viewed as equals, or in maybe what you've done or you've heard of? Sorry to put you on the spot, but I think that's a big part of this.
No, I think that's great. I'd be happy to address that. That is a big issue that we have, that the paraprofessionals are often thought by others not to have as important a job or to be looked down upon. So when we started, like, and as I described, our PLAYS program, one of the first communications we have is with the principal of how can you pass off your power, or how can you empower these folks? And empowerment coming in several different ways. One is a message to the school community that these folks play a very important role, and that when they're in the lunchroom and playground setting, they have the principal's blessing to be in charge. So often we actually will have assemblies where the principal and or lead teacher will talk about why these behaviors are really important and what, as a school, they want to do. And then we'll introduce the playground and lunchroom team and make a comment to the effect that when these folks are in these settings and I'm not there, they have my full authority. And then what we found is also powerful is we've actually had assemblies where the playground and lunchroom supervisors, they actually present on the new plan. We're going to engage kids in activities, we're going to do the rules, here's what it takes. And I think that, that's one powerful message. A second real powerful message that I think of in this context, we had a school and there was an issue with teachers not respecting the paraprofessionals, because when they would come to pick up the kids from the end of lunch, the kids would be too rowdy and disruptive. And so, we worked with the paraprofessionals and the school administration to help develop some lineup procedures. So they were coming from the recess, the playground, going back into the school. So we actually trained the paraprofessionals to provide awards each day to the quietest line, I think it was the quickest line, and the friendliest line. Again, it didn't really matter, but we were teaching them to use some behavior management strategies. But when the teachers didn't show up necessarily all on time, there were one or two teachers who were consistently late, the administrator would actually wait with the kids and to emphasize that the paraprofessional's time was very valuable, that they had dismissed the paraprofessional so that they could go on with their duties, and that they would appreciate next time if they could be on time. But so illustrating both that the paraprofessionals have a crucial role and that that's supported by school administration.
My experience in the schools is really the opposite of this climate, in that the teachers highly value the paraprofessionals because they have very difficult jobs. They're the ones that are in those unsupervised area. And I was trying to think, okay, how has that climate been maintained? And in part, it's the leadership in the building, but also in the schools I have worked in, the paraprofessional is considered part of the team. So there are meetings together, and when we have staff development, the staff development is with the team. So I think that really builds a partnership and a mutual respect.
I know that people in the audience may have questions or want to revisit this a little bit more, and we will have some time during the Q&A session beginning at 12 to do so. So right now we'll just move on to the next scenario. And this one is quite a bit longer. It's a little bit more complex, but some of the issues that come up in this case study are interesting, and I think worth spending a little bit of time talking about, and maybe I'll do a little bit of summaries to keep it easy to remember. So as a school psychologist, I first encountered a very pretty, socially outgoing third grader whom, when a classmate complained to her teacher that Nadine, had been talking mean. The teacher then requested that I talk to Nadine, and so she and I met over lunch break after receiving permission from her mother. Nadine was very, very surprised to hear that the other girl felt mistreated by her, and she couldn't come up with a single example that she had done to mistreat Emily. So I brought her and Emily together for a mediation, a problem-solving strategy commonly used at our school. Nadine reiterated her innocence, but Emily rebutted by saying, the day before, when I offered to help with your art project, I was told, or you told me, I was a bad drawer and that none of the girls in the class liked me. Nadine started crying and apologized immediately, and so the girls planned to eat lunch together the next day and work on being kind. In a follow-up conversation, Nadine's mother expressed concern about her daughter's mean streak and asked for a referral to his child psychologist who might address the behavior and some blended family issues. So we see Emily is being victimized by Nadine. The counselor becomes involved. It does this mediational process. Nadine proclaims some level of innocence. And they try to go on with being kind to each other, although Nadine's mother still has this lingering concern. So fast forward 2 years, and I met with a mother of a 5th grade girl who told me that her daughter, and this time it was Sadie, who was being badly mistreated by Nadine. Sadie didn't want to go to school and was afraid to meet with me because Nadine may find out. When I met with Sadie and her mother, I was told that Nadine had systematically persuaded 4 of her friends to stay away from Sadie, and they excluded her from social events and play activities during recess. Nadine also used note passing in school and MySpace to communicate with these 4 girls. Sadie declined to go through the mediation, but was willing to attend a meeting with her 4 former friends. During the meeting, the girls expressed their remorse to Sadie and told her that they didn't dare cross Nadine for fear that they would be her next targets. In the ensuing months, several things happened. Sadie met with me for assertiveness training. The 4 girls spent time with Sadie out of school, but were hesitant to do so in school. Nadine's mother required her to see the psychologist again, but that petered out after 1 visit. Eventually, Nadine went to live with her father, who did not support her mother's concerns and recommendations for counseling. So, fast forwarding 2 years from the initial encounters with Emily, Nadine was still exhibiting these aggressive behaviors in school. Her mother was still concerned, but apparently there was some trouble with follow-through. This situation was the resolution, as it were, was a little bit different in this situation because Sadie was not interested in that active mediation process. But it was clear that this was a larger peer group phenomena. The other 4 girls that were involved were afraid to cross Nadine for fear of being the next target. And so this is a really, really complicated situation, but it is one that has a lot of authenticity. It's one that we hear through our work anecdotally very, very frequently. And so the question is, what are some other interventions or some other strategies or some other techniques that might have produced a different outcome for Emily, for Sadie, and of course for Nadine? So.
Sure. I guess the thing that stands out most in my mind is the use of mediation in a bullying situation. I mean, there's many things about this case scenario that are interesting to me, but the use of mediation, just a note of caution. Peer mediation is a wonderful thing when the 2 parties have equal power, but bullying is about an imbalance of power. It can be social power, physical power. And I think the case beautifully illustrates about the 2 girls in 3rd grade agreed to something. Nadine, she expressed remorse when she maybe didn't feel remorse. It seemed like there was a solution, but there really wasn't a solution. And I think Sadie, at her 5th grade level, was very wise to decline mediation because she realized that it was going to be possibly an effective solution. And she also didn't want to be put in a position where she had to confront the person who was bullying her.
So one of the things that I think this case really illustrates is just how powerful this dynamic and the pull is around relational aggression. I mean, when you think about it, that Nadine, this girl, this, I guess, 5th grade girl, by the end of the case, is influential enough that the other girls don't even want to meet for fear that she will know and react to this. And so I absolutely agree with you. I think mediation, the power imbalance is so off here that, I'm not sure how helpful mediation would be. I mean, I start wondering about, where are the other adults at the school and how do we pull them in? So, first of all, where does this primarily occur? Is it in the classroom, and how does the teacher feel? Are there, playground and lunchroom supervisors who see this occurring? And because I think that for us to support kids who are being victimized, we have to demonstrate as adults that that there's strength in numbers, and that so I do think, similar to the first case, that there needs to be a systemic level change, but I think it's really by getting together some of the adults who have power, if you will, across the different settings to sort of address how these can be handled, and then what type of message can be given to the children as a place to start.
I totally agree with both of our other panelists, and just wanted to add something that might seem obvious, but it's often overlooked, which is that the victims in this case need validation, that this isn't in their minds, that they aren't crazy or et cetera, by the school personnel.
That's a great point, because I think so often we work with the aggressor and we don't spend a lot of time with the victim. And in my experience working with the victims, to empower them and to build a support system is very powerful and makes some real changes to the aggressor's behavior.
Another interesting thing about this case study to me is that statistically it's been shown that oftentimes the most common aggressor in a bullying situation is either a friend or a former friend, and this is most true for girls, not for boys. So this dynamic is really very true to form. And looking at what we can do to engage our bystanders, those kids that are not directly participating in the bullying, but they have a definite role to play, and giving them support to do something in this situation. Like these 4 girls are very fearful, and you want to provide them with some strategies of how they can respond. And when you put that out to the kids, the first thing that they say is, oh, I should confront the bully. Which is a really hard thing to do. But statistically, the research will show that kids will benefit most from just what these 4 girls are doing. They're being a friend, and it may be behind the scenes, but they're still taking very powerful action, because Sadie, if they didn't, Sadie would be feeling very isolated, feeling very alone. But they're, by doing this behind the scenes, even though they're afraid of Nadine, they're still showing support for Sadie, which is really a critical element. So you may say that they're not showing bravery or courage, but they're showing a lot of courage by just continuing to befriend her, because that's one of the most important things they can do. And also just figuring out ways to remove her from a bullying situation are very important too.
In a recent conversation with a colleague of mine, who actually happens to be here today, we were talking about relational aggression, and his comment was that in so many of these cases, I really wonder if we can't speak to attachment theory, and that these aggressors never really had that sense of I am loved, and that much of their relational aggression is an outcome of that. And I have to fess up, this is my case. I think with this individual, I think that may be very true. One of the things that I thought in retrospect, and it was a case I was in this building not as frequently as I would like to have been, I think it would have been great at 3rd grade or even earlier to have some training sessions with Nadine and some role models and maybe some at-risk children. I've done that, and I found that to be very effective, particularly with kindergarten and 1st grade children, where half of the session is the training session where the classroom teacher has given me the examples of the relational aggression that's occurred during the week. We reenact with a positive alternative behavior. We talk about, first of all, what the problem was and the chain of events that happened after it, then practice the positive alternative. And the other half of the class is doing something really fun together. And they always look forward to it. For me, it's an opportunity to really reinforce the training that went on before it. And I found that to be a very effective intervention, particularly at that young age.
I want to emphasize a very good point that Paula just made, which is that relational aggression isn't just a problem among like middle school and high school girls. I think a lot of the media attention that this work has gained has focused primarily on those age groups. And we know that the earlier you can intervene or prevent a problem, the more success you typically can have. And so it's great to hear that you're intervening with those kindergartners and first graders. And you might also find it interesting to note that people like reviewers on grants, for example, often don't consider these behaviors to be a significant problem in young children, even though research shows that it is. So good for you.
I was also going to agree. I think that it's so important to recognize that, you know, relational aggression, it's uncomfortable, right? I mean, it doesn't feel good. And so it's easier sometimes if the problem kind of goes away. But I think, as Paula and Nicki mentioned, and I think as this case shows, that we can't ignore it. And, you know, and I think that I agree, Paula, that there really needs to be some skill building, some sort of problem solving, skills perspective taking, thinking about how would this make others feel. And I think that, you know, often we wait till the point that it really becomes a problem. And I think it's great to think about as early as we can engaging children in these discussions and then taking seriously if someone has a problem with it to try to draw the parent in as was done here, and to try to provide as much role-playing and reenacting, because I think that's a really powerful technique for helping kids understand that there's more than one solution. There's more than one choice that they have.
I also just wanted to comment on Nadine's use of MySpace to, you know, as a vehicle for bullying, and with you know, within our organization, we always call the internet the new bathroom wall. And it's where kids used to be able to just, you know, bullying was pretty much confined to school or the neighborhood. Now kids have a venue to bully, you know, reaching hundreds, thousands very quickly, real time. And this is really, they're the first generation who's dealing with this. And one of the most important things that we as parents and as adults can do is that when our kids are first asking for that access to Facebook or their cell phone, is to have a conversation around bullying and, you know, hurtful and harmful messages, so that they, number one, recognize that if it's happening to them online or in person, it's still bullying. And also, number two, the biggest reasons that kids won't tell that they're being hurt or harmed online is they think that we as parents, that our gut reaction is going to be to remove their access to technology. And really, we can't do that to our kids. They need technology. What we want to do is make sure that we have rules set up around it. It's like an analogy. You wouldn't throw your child into the deep end of the swimming pool without first giving them swimming lessons. You know, so you shouldn't be putting them out there on the internet without giving them some rules and policies, much like you do when they go to the mall. The other thing within this situation is that so much of you know, relational aggression and social aggression for girls is very covert. You know, girls can bully by giving each other a look up and down, and we all know what that means, like, what are you wearing, you know? And that's awfully hard to capture and to quantify, but when they're putting it out there on the internet or MySpace, that's a lot easier. All of a sudden, there, as sad as it is, there becomes a history, there becomes a trail, there becomes tangible evidence that there is bullying. And, you know, and that can be used in ways to help, you know, helpfully remediate a situation and move on.
Steve had mentioned that many of these aggressors have leadership skills, and Nadine is an example of that. She did have leadership skills. And a strategy I would like to have tried that we use in a different school that has been very effective is a buddy system. It's for the first 2 months of the school year. 5th and 6th graders are trained to be buddies with 1st and 2nd graders at lunch and recess. So the teacher trains the 5th and 6th graders to be role models. It's a very confidence-building program, and they take it very seriously. They meet the children in front of the classroom, go to lunch together, they sit with the child at lunch, and then out on the playground, they help teach the children various activities and how to use certain equipment. It's been a great program. Unfortunately, it was discontinued when they made a major schedule change in the schools and couldn't pair them, but I would recommend it if it's possible.
I'm struck by, I think that's such a great example, because I think that if we think about some of the relational aggressors, that are pictured here and that we know, I mean, they have very strong skills, social skills, in order to evoke these types of behaviors. And so, I think that thinking about roles for them, that we can shape positive behaviors through leadership and creative ways to do that, so that they're busier during times where they might otherwise exhibit relational aggression, is such a great strategy. And it's a shame that that program couldn't continue, but I think it's still a good example for ways in which to engage children around leadership. The other thing we find is that sometimes it's not about telling kids, well, you're going to do this so that you don't do that. It's just presenting the opportunity and giving them the opportunity to develop more self-confidence and feel good in another area, but making it, so that it's almost incompatible with the same behaviors as you're describing, I think is so important.
I don't know if this is allowed, Pete, but I'm going to ask Steve a question that's related to this. You talked about bullying hotspots and how they play out on the playground. You gave a really good example of the trailers hiding kids' activities and that sort of thing. Well, I've always wanted to do research in the bathrooms. And I wondered, because that is a place where a lot of this stuff takes place, and I wonder if you've thought any at all about including that context in your interventions, or whether you think it's even important.
So I can honestly say we haven't thought that much about doing research in the bathrooms, but
hard to get past those IRBs.
Yes.
Yeah.
No, but in all seriousness, I think that we have seen that a lot of aggression and social conflicts do occur. I say in the bathroom, but I think it's the way that kids can separate themselves from others at times during the lunch and recess. So when we've done our PLAYS program, we've actually talked a lot about even routines for the bathroom, which sounds almost ridiculous, but sort of like, do you want one kid to go at a time? Do you want to use the bathroom, have a class use the bathroom on their way in, on the way out? Who's going to supervise that? And that, and that becomes a real issue too. So we haven't thought about it from a research perspective, but I think certainly clinically, depending on the school and my guess would be the better the supervision and the activities during the actual lunch recess, I would think potentially the more likely it might be to pop up in other unstructured settings such as that. So I think it's something to keep our eye on. And I can't quite picture the research we would do, but I think it's an interesting, idea.
If you ever figure it out, let me know. Maybe we can partner on that.
Sounds good.
I would think another very unstructured setting is a bus. If you think about the school bus where there's a driver, and what does that driver do? They turn their back on 60 kids, so that they can drive, not monitor. So it's a very unstructured setting. But I was going to comment about a project that Pacer Center And Pacer Center, who I work for, at our core, we're an organization that works with families of children with disabilities. So within all our intervention strategies, we're always thinking about our kids with disabilities in particular. And we have structured one program that's been highly successful, and it's based on just best practices, some of our intuition, and also kids with disabilities will have individualized education programs. And what we found at schools is that kids, they want to do something about the bullying, but they just don't have supervised, structured projects to do that. So we started a very grassroots effort with, it was based on 2 kids who have Down syndrome. And in fact, one of those children is my son. When he was going into 6th grade, just knowing that the dynamics change a lot, much more in structured settings. And also, my son is nonverbal. He has a pacemaker, he has a feeding tube. So some real differences going on where he could be picked on very easily. And what we did is we trained 16 students about bullying, and we also trained those students what they could do if they saw any of these 2 students in a bullying situation. And the kids, they loved that project. At the end of the year, we had such great outcomes from it. And then the following year, the special education teacher, she did it more systematically, and there was actually 30 kids. The first 16 we hand-selected, and the next kids came on. They said, we wanted to do this. And really what we found was that the group started to support each other more and more, and it really became more about social inclusion for the kids with disabilities too. That was the unexpected byproduct of it. And right now in 8th grade, there's over 50 students involved voluntarily in this project throughout the middle school, and we're piloting it with other schools too at a very high success rate.
I'm gonna step in and say that's an incredible story. I mean, that's a really heartwarming success. Taking a step back, I want to move on to the next case study here, because it seems like the group was naturally moving in that direction. And it has a lot to do with some of those unstructured times, those unstructured activities. So this is about an 11th grade student who was expelled for fighting. I would presume physical fighting. After digging deeper into the situation, it was discovered that this young man was bullied beginning in 6th grade when on a 5-day school trip. For some reason, he had a condition that required him to use heat packs. And the boys began picking on him, due to that, and it lasted several years. And he was ousted by the popular group to the larger peer group, and was forced to sort of start hanging out with the quote-unquote druggies here. And he never told anybody. He never told his parents about this during the intervening years. Finally, though, upon his expulsion, he disclosed the teasing and the ongoing rejection by his peers, and his sort of resignation that he had to fight because he couldn't take it anymore. And so the comment from the submitter here is we hear reports that confirm a lot of relational aggression occurs during unsupervised times at school and on the bus. And so, maybe our panel could speak a little bit more to some particular strategies or some particular ideas on how those people in those situations, the adults in those situations, can intervene or can be aware of the problem and then intervene. So,
I want to first note that this is a very good example of how relational aggression can turn into physical aggression. And what really concerns me about this scenario is the fact that this behavior, this maltreatment, has been going on for so long. Because there are many anecdotal examples, including a recent video on YouTube of a case in which a boy was picking on another boy. And interestingly, the bully was much smaller in stature, which is unusual, than the victim. And I don't know how long it had been going on, but it had been going on for a long time. And until the victim lost it one day at school, picked the smaller boy up upside down, and then smashed his head into the ground. And he suffered a number of fairly serious injuries. But you can imagine the buildup over time that this child in this scenario is probably feeling.
I think this is a case where this child never had a trusting adult available to him. And that is a big problem in large schools, one teacher, 25 to 30 students. In some of our schools, I feel like we have made some gains in that regard. And junior high typically is one of the more difficult climates for a student to have any kind of a relationship. But in one of our junior highs, we have daily advisory for half an hour every morning. They have the same advisor for 3 years. And of course, it's adult specific, but in many of these cases, this is the trusting adult they can go to.
I think along the, excuse me, along the same lines, I mean, when we look at this, it's amazing that this went on as long as it did, and the parents, it seemingly are unaware. And I think that that's really concerning. And I think, just Paula, as you're saying, I mean, sometimes advisory periods, especially where there's continuity of a significant adult, I mean, it's tough because, you know, it's not a blame game. You know, we all are in this together to try to help the children. But it seems like this person did not have a significant adult role model. And, you know, while that may be, they were in a tough living situation potentially, you know, I think that the idea of trying to have a point person at the school, and I think that's one of the most powerful things we've found at times for both the bullies and victims, that knowing that they can take some comfort in, they have somebody who's on their side that they can talk to, even if it's not their parent, can go a long way to try to integrate this into an advisory session, into counselor role play in the office. And I agree with you, Nicki, that this is an unfortunate illustration of how relational aggression, you know, a lot of times people focus in the media on the physical aggression, but I find often when we really backtrack, many times the physical aggression is the end result. Not always, but a lot of times it starts with situations where it's teasing, with relational exclusion or rumors, and it's reinforced over time. So I think this is a very complex situation that unfortunately highlights a lot of the ways in which this can break down during the school years.
I guess my comment to this story, and I was actually the one who submitted it, is that oftentimes, you know, kids don't tell an adult, and they don't tell it because, and Stephen said some of this earlier, there may be shame around it. But a lot of times they do try to tell an adult, and a really common response that we get from well-intentioned adults is, oh, just ignore it, you know? And adults say that in the best spirit, but we've had kids say to us, and there's a great spot on one of our websites where we have an interactive section, and one of the kids will say that, and then they'll say in response, you know, what if I told you to just ignore your bills? Would they go away? What if I told you to just ignore your annoying boss? Would that go away? And so, again, it's a well-intentioned response, and it's kind of that underreaction. Kids also fear that overreaction where, again, you know, we're parents, we want to protect our kids. The first thing we're going to do is we're going to go call the person, the parents of the person who's bullying us. We're going to go into school with, you know, all out blazes. We're going to change the situation. We're really kids, if they're coming to us and they're talking to us about bullying, really what they need most is just to start thinking about some effective strategies that they can do in response to the situation. And by as adults not giving them those strategies but talking them through that, they're going to feel more empowered. And if they can figure out the strategies, they're more likely to carry them through too.
It's mentioned in here that a lot of the aggression occurred on the school bus, and any of us who work in the schools know that that is absolutely true. Several years ago, when our bus drivers were actually district employees and not contracted services, I asked if I could do some training with the bus drivers, and I was able to do that for several years. I titled it Dealing with Challenging Behavior, and I think the drivers were thinking I was going to suggest all kinds of consequences and things they could do. And while that was a little part of it, I spent most of the time on relationship building. And I said, number one, you need to know the name of every child on that bus. And when they walk on the bus, you need to say hi, you need to look them in the eye, and use their name. That in itself is a huge intervention.
I think we'll have time for one very brief scenario, the final one. 2 girls in 4th grade of equal status and physical attributes created problems for a number of classmates. This is an interesting scenario. They were competing with one another for relationships, sort of like a notch on the belt kind of a thing. They would use manipulation, coercion, put-downs, name-calling, eye-rolling, exclusion, kind of the litany of relationally aggressive behaviors towards the kids in their class. And so they viewed friends more as possessions, and they were upfront about being bullies to each other and to their quote-unquote friends. School staff tried having the girls meet individually with the principal. They attended group discussions, completing written assignments about problem solving. You got detentions, alternating recess times. This really seemed to be of little avail. And each girl admitted to bullying others because they got what they wanted out of it. And so the final strategy that they came up with was putting one of the girls to work in the library during the recess period. I don't think that's a good thing for literacy education. But anyway, I digress. And then after 3 weeks, she returned to recess. Both girls seemed to have shown improvement. And of course, once the parents were, I shouldn't say of course, once the parents were involved in this situation and informed that their daughters were being bullies, that they did take a little more active role in working with them. But this whole process was a 7-month. I mean, almost an entire school year was effectively lost. Any thoughts on how this might have been addressed in a more timely fashion, a more effective fashion? This one's a tricky one. This one is a really interesting example of sort of how ingrained it can become into the whole classroom environment. So,
I guess mine would be to really to not focus so much on the 2 girls themselves, but to really look at classroom culture and what you could do to empower the other students that this has happened, that the girls are taking this action against, because giving them some power to be able to speak out against the situation is going to go a long ways, because it's going to take the power away from the 2 girls who are showing that behavior. And giving them permission to do that in a way that they don't become, so that all the rest of them don't become, bully those 2 other girls, but to really frame it very proactively. And I also think, taking away recess as a form of discipline, it's probably not going to work. It's more about what can you do to teach really effective strategies and with a positive reinforcement to it. It's a tough one. Mm-hmm.
Yeah, I wonder if it would help to involve parents early on as well.
And I mean, I think your point about, impacting the bystanders, I think it's really important here, because I think if the aggression and bullying is working, then it's almost like we need to start with the systems around or supporting that. And then I think to come back to the individuals, in terms of either role-playing or problem-solving, as well as certainly involving the parents. But I do think a thought of involving the school climate, the class climate, the teachers, so that other children feel more comfortable knowing what they can do, and that they'll be supported in that, I think is a really important first step.
What strikes me when I read this scenario is, I may be reading between the lines here, but it seems to me that the 2 bullies are kind of proud of what they're doing, and the way that they talk about it. And I would want to try to understand what's behind that feeling for them, and to explore alternative ways that they could feel proud of themselves.
This reminds me of a strategy I used very early on in my career, in my naivety. Teachers would come and say, I've got this group of 5th grade girls that are aggressive. Can you have a social skill group to change your behavior? And what I found was it was really energizing for those girls. In fact, I concluded, looking back, that it was like consensual relational aggression. Their goal was not to solve problems. So I would not recommend, and it's mentioned here, these group discussions with the aggressors.
So I think you're bringing up a really important point. In fact, I was talking with someone during the break about this, and I think what we're talking about, I think you're talking about what's now called in the literature group deviancy training. The idea, and it's, you know, that's, there's probably a better word, but the idea that if we bring together aggressive kids and they're reinforced for some of their behaviors, not only are they going to get their behaviors worse, but it reinforces and makes other kids' behaviors worse. And I think your point's a good one in that when you do a group intervention, like we train our facilitators very well, and you have to be trained, you know, on how to deal with these behaviors when they come up, because it's sort of like the playground during recess. It can work really well, or it can work not nearly as well. And so I think that, you know, one of the pieces that's really important to think about when we talk about strategies is all the strategies need to be pretty systematic and structured. Because I think if we try things and, you know, especially getting a big group together, which I think can be very effective, but it has to be very structured and have a curriculum and be practicing certain skills and role-playing for different solutions. Because I think without that, you know, there's certainly the possibility that we're giving actually some of these kids a forum to sort of perform. And I think what we really want to be doing, and Nicki, I liked your point about better understanding what's behind this and what they get out of it. I would look for leadership opportunities that are consistent with what's important to them. And, you know, that might be an area to think about, you know, instead of maybe putting someone in the library, you know, think about what would mean something to them that we could encourage them to be a leader. But I guess my main point is just that we have to be systematic and structured in whatever we do, especially when we get the kids together.
Thank you. It's a few minutes after 12, and so I appreciate your comments. I'm sorry, I feel like we could probably talk about this scenario longer, but it is time for the next portion of today's workshop. And what I want to, before we begin the question and answer portion, I need to make an announcement. Thanking the sites, the 28 sites in Greater Minnesota who joined us today. We hope you found this morning informative and very interesting. We invite you to continue your participation through the Q&A. For those sites who choose to have your own discussions, please do so. You want to disconnect your broadcast link at this time. And those sites that are remaining for the discussion period are asked to email questions to cmhdata@umn.edu. Again, that's cmhdata@umn.edu. For those of you here in the Metro audience, we have several volunteers floating around who will collect your written questions. We will submit as many as time allows for our speakers. And of course, feel free to ask questions about the case studies or Dr. Leff's presentation from before that. Okay. We'll start with Brainerd. I hope they're not getting hammered too hard by the snow. Could you speak a bit about how to adapt some of the intervention strategies you've spoken to preschool children? This is one of the things I was thinking about with Nadine. Perhaps if we had been able to catch someone earlier. So what would you say? How could we do that? Or is there some existing research out there that works with this age or developmental level?
So that's a really tough question. Tough question because it's a tough answer. The work that we've been doing, as I mentioned, is focused on a social information problem-solving model. So the types of social cognitive strategies around perspective taking, empathy awareness, you know, becoming a better, providing better understanding of the hostile attributional bias, that takes a certain level of cognitive sophistication. So we typically think about third graders as being the youngest for these types of approaches. However, you know, we need to address this at the preschool level, but we need different types of approaches. Certainly, playground and lunchroom and strategies are appropriate. There's been a lot of research in daycare settings some of the early articles, I'm a basketball fan, they looked at a man-to-man versus a zone approach to supervision in the daycares. What they found was that the zone approach was a lot better. And what I mean by that is that they were able to move around, to be flexible, to meet the needs of other kids, and for the adults to try to engage kids in different activities. So I think that, encouraging youth to participate in age and gender appropriate activities is important for younger kids as well. And then there have been a few people who have done some studies looking at relational aggression interventions for preschoolers. One that stands out really started with the rule, you can't say you can't play. And although I think it's more complicated than that, still having that be a rule where young kids are taught that we value inclusion and working together, I think that's at least starting the conversations about the importance of including others and about cooperative play. So, I think that there's much more research that we need to do with that population, but I think thinking about sort of playground and lunchroom and daycare settings, and also how we set up our classrooms to promote inclusion could be the start in those situations.
I've always thought it'd be really fun to make up some songs that have to do with relational aggression and bullying in general. Preschoolers really enjoy that kind of an activity, but I haven't done that yet. I'm not much of a singer.
There are some programs, I think, Steve, you mentioned one, that directly addresses early childhood. One of my roles is coordinating the early childhood special ed programs in the Stillwater schools. And our school psychologist this year is implementing the early learning version of Second Step as sort of an experiment. And she's having a great time with it. And that's using puppets, songs, rhymes, lots of basic training, developmentally appropriate. But there isn't a whole lot out there.
I think this question that I just got is pretty interesting. It's perhaps from a perspective that we don't often think, that of dads. The question is, how can you handle parents who are not supportive of intervention strategies? And the example is, we have some very physically aggressive boys, and it is physical aggression, but I think the issue with dads is important. On the playground when playing football, and when we talked to the boys and intervened and took away football as an option until we could come up with solutions for keeping it less violent, we received nasty emails from multiple dads telling us that we were mean and that boys will be boys. So, what is there anything that you can think of with dads and how dads might react or be different than moms? Or that's interesting, I think.
Go ahead, Nicki.
This isn't about the dads. I'll let Steve handle that one.
Okay.
I just want to point out, though, that I wonder what else is happening when they play football, or what's happening behind the scenes before they get into the physical fights. I guess I've talked with a number of coaches over the years, and of boys teams as well as girls teams, and even from the coaches of boys teams, they tell me that often relational aggression is a huge problem on their team. So I would want more information about the whole process, and if I were going to try to intervene.
Yeah,
Take it away, you're a dad.
So one of the things I think about with our playground and lunchroom program, it was interesting because often when we would talk with the schools, and again, I said, most of the time in Philadelphia, there weren't many activities going on, so it's a lot of blacktop space. And what do kids, and sometimes what do the adult male volunteers do? They bring a football and they throw a football around. And I think one of the things that we would often be confronted with was the idea that if we take away football, we take away the fun. And so we actually started working with the young, either dads or males who were helping to volunteer on the playground, finding ways that they could keep the games, but make them a little bit less competitive and a little bit, less chance of bumping and hitting. And so, so instead of some activities we would do, seeing who could catch the furthest pass. They would do some relay races, or even with dodgeball, teaching the kids, it sounds funny, to bounce the ball down first as opposed to just throwing it at someone's head, which gives dodgeball, I think, a very bad name. But the idea being that, we actually I had to accept the fact that kids need physical play. And I think when I started about 15 years ago in this work, it was sort of like, well, if we cut this out, then it won't lead to aggression. But what we know is that kids do need some of this. And so, but I think it's modulating it. I think it's thinking about how can we do this in a safe way? How can we provide a range of activities for kids? And then I think the other really important point, and Howard Stevenson at University of Pennsylvania has done, I think, some phenomenal work about looking at physical aggression in the context of competitive games among adolescent males. So in other words, that we have to be ready to teach in the moment in a basketball game when there's a conflict, that's a teachable moment. And so I think that, the next step for these types of interventions may be really teaching the coaches and teaching the paraprofessionals, not just on supervision, but on how to take a potential aggressive incident, physical or relational, and in the moment intervening. Because I think there's some evidence that, especially around physical aggression, if we intervene, we can reteach at that moment. But it's tricky, and it certainly requires more training.
Perhaps this is a teachable moment for the dads. We want your kids to physically play. We want them to do that, but we need to be aware of when it crosses the line. And as a parent, we want you to know that's our concern, not football per se.
I think that's a great way of stating. There are rules that we still have to follow, but clarifying the lines of communication too.
So I've got several questions that I'm going to kind of combine because there's some themes that are emerging here. One of them is, it's kind of distressing. There's several cards here that are asking, how do you convince the administration this is a problem? I'm a parent or I'm a teacher. One of them looks like a preschool, another one is a Montessori school, another one is just a standard elementary school. So people are concerned in the audience. What can they do, or how can they get the ball rolling to kick off some kind of conversation or change at their school?
I'll start. And this is a challenging question because I think that, where are we most effective with our programs? We're most effective, I think, we're going to find in schools where the administration is most supportive and where we have strong leadership who really wants the programs. But, one of the things that, I'll answer a slightly different question to start. One of the things that we do when we're looking for schools to do our program in is we arrange a time if we've been referred to a school or if we've heard about a school that may have a need, and we talk with the administration and we try to gauge if they're interested in the program. But then we also request to meet with the whole staff and say to them that, we have some strategies, certainly may not work in every school, and we recognize each school is different, but we want to put out there, here's what we do, and we want to hear what the problems are and see if this is a good match. And so I think become a really big believer that not every program, not every strategy is right for each school. And a lot of success happens by the match. And so I think, if you're concerned in your school, trying to, at a professional development day, finding the right forum to address what the problems are, how people see it, what contributes to it, and then what are the types of strategies out there that might be effective. Because there are phenomenal programs. Second Step is a very good program that's been around for a long time. But each program requires different buy-in, different time commitments, and sometimes different commitments from different folks throughout the school community. So I think that to start the conversation is, here are the concerns that we have, how do other people see these, and as Nicki said, where do these lead? It may have started as relational aggression, or it may be that we're concerned about very violent, physically aggressive incidents, yet, if we look at it, maybe there are other factors that are causing the buildup to it.
I think a barrier to providing these programs is a pervasive lack of trained staff available to do this, and time with the high-stakes testing that Steve mentioned earlier. It's very difficult to persuade classroom teachers that this is an important part of the curriculum. But I found in my experiences that there are some great moments when you can influence administration, and I agree that if you're really going to have a successful program, it has to be top-down, has to be supported top-down. But I have found that even in elementary schools and secondary schools, administrators spend a lot of time dealing with physical and relational aggression. So when I have had involvement in that and had an opportunity to say, you know, here's something we could do school-wide that might be proactive, and if we can find the money to support it, which is the other challenge, we've been able to have programs. We have Second Step in most of our elementary schools now, and it's because administrators were sold that, you know, it'll save us time in the long run.
I think also it's important to figure out what the administrators, the barrier is for that particular administrator, in addition to the things that you just mentioned. And in some cases, I think that folks are not convinced that this is a real problem. And so if that's the barrier, there certainly is lots of research, and if the administrator is someone who is data-driven at all, or you could show them or summarize for them what the long-term and immediate effects are for kids who engage in these behaviors, as well as the kids who are victims. Many of the things that we've been talking about during this three-part series.
I would just add, too, a note of caution. You know, oftentimes schools will contact our organization and they'll say, well, we want to hold an event at our school about bullying and we want to talk about it. You know, and I'll always say, is this just going to be a one-time event? And they're like, yeah, that's what we're going to do. And, you know, and that's not a solution. In fact, if you talk to kids, they'll tell you that those situations, without any you know, pre-work or education or support in place to accompany that, oftentimes makes the situation worse, because what happens is the kids who really need the message are the ones up in the audience making fun of it, and they're creating even a more intimidating environment, using that as a vehicle, that presentation as a vehicle. So just again, you know, note of caution, not an effective strategy.
And I think what you reminded me of is that I think often people have different perceptions of what might be effective. So we've been asked at times, you know, when we've done work in the community, we have some programs in after schools, you know, where we've targeted, you know, we can work with this many kids within this age range, you know, 10 to 12-year-olds. And community members have said, well, I have a better idea. You can work with every kid, 300 kids, and we'll make sure, you know, from age 5 to age 16, we'll bring them in one time to see you guys, and that way you work with everybody and everybody gets it. And so I think, you know, what we've had to do, which is tough sometimes in community forums, is actually some education about best practice. Because I think that, you know, not only do you have to match well with a program, but there's certain things that, you know, we recently were asked to do a 45-minute workshop for all the 5th graders at a struggling school. Not for the teachers, you know, for the students. And it was coupled with 2 professional boxers coming in and sharing their story, which I didn't get. And you know, but we had to reset the expectation for what we could accomplish. What we could accomplish, I thought, is maybe setting the forum for the school to decide that they wanted to move forward with finding a program, you know, that we could build some awareness. As an aside, the boxers told a story of, you know, that they learned not to run away and to be tough, but then they said, but you guys don't do that, you know. You shouldn't do it. Leave it to the professionals. So I felt like I had to come up at the end and sort of try to, I don't know, frame a different message, because, you know, the message out there sometimes is violence pays off. And I think that we as a community, you know, that part of starting this process of engaging in schools, with teachers and parents, is that it doesn't pay off in the long term for the most part. And that's why we have to think about strategies. We have to think about what we can do in a reasonable amount of time and with the resources we're provided, which is always challenging.
It just struck me that perhaps the school was trying to demonstrate future careers for aggressors.
Just follow up, we have a question here. They're asking, this person asks, a lot of the students and families we work with live in poverty and unsafe neighborhoods. You know, there's gang involvement. And so there seems to be this pervasive perspective that encourages aggressive behaviors out of necessity in terms of staying safe in the neighborhood. And I mean, Steve, you were just sort of talking a little bit about that, but I mean, your neighborhoods probably are very much like this. So I mean, what do you do?
Yeah, and that's, you know, that's a really, that's a key question, because we can't really say in a lot of our schools and our communities, walk away, don't fight. Just, you know, as a general rule, that's not necessarily respecting some of the neighborhoods and the environments kids are coming in. If a kid is in the process or afraid they're getting jumped on the way to school, I mean, that's a real situation. So what we teach, and I think what has really resonated with the educators and certainly with the parents in the communities where we've been at, is that we're actually not necessarily teaching aggression prevention, we're teaching problem-solving skills. And that part of being a good problem solver is to understand the situation you're in and what your options are. And so we've had parents really come on board by saying, okay, well, I understand that maybe there's a situation that's happened in the community, you know, where your child had to do this. You felt they had no choice. But let's think for a minute, if they do that at school, you know, what's the consequence of that? And so helping kids better understand that in order to be successful in life and to rise above some of the challenges, we have to recognize the social setting we're in and the positives and the consequences associated with each of the behaviors within that. And that's resonated, I think, with some of our families, because it's not just walk away, don't fight. It's, you know, think about your situation, consider the important characteristics, and then hopefully be able to make the best choice you can at that time.
Sort of to balance that, I have a comment here on one of the cards, and they ask a lot of questions, but I'm going to just start with this first one here. This presentation suggests that aggression, physical and relational, is most prevalent in urban schools. And I think we probably should address that that's not the case. I mean, Paula, you work in Stillwater. Could you maybe start addressing that?
Well, I would totally disagree with that. I think in one of your articles you said 20% of the girls, sometimes it feels like a lot more than that, are aggressors. There is plenty of it happening. I don't think it has anything to do with urban, suburban, or rural.
No, in fact, you know, bullying can happen anywhere. And I think one of the things that, you know, a lot of times people will say, well, a small rural school, who's going to bully there? But what happens in that situation is that in a smaller class size, if somebody is being bullied, they don't have another peer group to move to in that setting or situation. So, you know, I grew up in small South Dakota communities, and if a child was bullied in kindergarten, they're probably still being bullied in 12th grade. And so it's an issue that knows no boundaries of class or gender or socioeconomic. In fact, kids are bullied for a variety of reasons. You know, one of them being most predominant is weight. You know, we hear a lot about in our body image. We hear a lot about LGBT kids or kids with disabilities. And so the reasons that this happens are varied and complex.
Yeah, and I'm so glad the question was asked, because I do want to clarify. I was not implying that it happens only or predominantly in urban areas. It happens everywhere. And when we consult in the suburban school districts, I'm often struck by the similarity in the issues, the concerns, the fears, and the problems it causes. I think, you know, one of the things I believe in is that whatever setting each setting tends to be somewhat unique. The problems of relational and physical aggression transcend those bounds, though. And I think that sometimes settings that we work in, or that I work in, the resources are pretty poor. And sometimes we see in some of the other settings that the resources or the ability to have resources may be a little bit better. However, I am struck by the fact that I do the same talks and consultations in the suburbs that I do in the city. The issues are there, the concerns are there, and one of my original questions when I met Nicki, years ago is that, when I moved to Philadelphia, would relational aggression be a problem in the urban areas? And I think she said to me, I'm sure it will be. And I've learned it really is, as well as physical, because I think that, these types of behaviors, they're part of human nature. I think the goal is we have to learn how to deal with them effectively, taking into account whatever settings we're in. But clearly, these are problems that we're all struggling with. It's not just an urban issue or a suburban or rural issue.
Thank you. I think we have time for one more question, and maybe put this on Julie to start with. What programs or strategies are most effective for students with little insight and/or cognitive ability? You talked about sort of that strategy where I guess the non-impaired students are helping be protective, but what about the students who are having those difficulties? What can we do with them, or what have you seen?
What was the last part of that question?
You talked earlier about how those students were providing that community of support around the disabled individuals.
Okay.
But what about children who have impaired cognitive abilities or limited insight? I mean, what are some techniques or some strategies that maybe work for them, both as aggressors and perhaps as victims? It's not clear.
Okay, sure.
Sorry.
Well, I think one interesting part of that peer advocacy model that I described is that, oftentimes as a parent of a child with disability, myself included, I make the prejudgment, oh, my child would never bully somebody else. But in fact, they do. And there was a situation where the other girl involved in this program did bully somebody. And what the peer advocates did with their training is they approached her and very, using their training, let her know that that was a bullying situation and what she, how to handle it the next time and what she needed to do to make amends for that situation, which I thought was really fascinating. But as far as just when you have a child with limited cognitive abilities, what we have found is the most effective thing, because again, even with our son, it's just communication, is engaging everybody around him to understand, and I think it helps to, whether the child has limited cognitive abilities or another population that's really bullied a lot, or kids with learning disabilities or kids with Tourette's, is just, from very early on, having those kids become self-advocates for their disability and really understanding what their disability is, so that if someone does tease them about something particular, that they have a strategy to respond to that situation, and teaching that from a very early age. Those, we call them self-advocacy skills.
Thank you. I think looks like we're about out of time. I wanted to end this portion by saying I've got a ton of cards here. I'm sorry that we couldn't get to them all. A lot of them deal specifically with Steve's programming, whether the materials are available, questions about grants, questions about sustainability, or so on. So what I would suggest is writing this down, leff@chop.edu, and shoot him the email, because I'm sure he'd be willing to wade through a couple hundred questions in the next few days. So,
especially when you put it like that.
Yeah, well,
no, I'd be happy to try to answer any remaining questions.
Yeah, and also we'll try and put as much relevant material on our website as possible to help you access materials that are public domain. I want to thank Dr. Leff, Dr. Crick, our panelists so much. It was a great afternoon or morning. Afternoon's coming. It's a great morning. Thank you so much for your time, and thank you for the audience around the state and here in Kaufman Union for participating. I think this was quite enlightening, and hopefully this leads us on to more concerted action around these issues. We're done for the morning session. Those of you who are leaving, please hand in your evaluations and pick up your certificates of attendance as you exit. For those of you who are staying for the afternoon session, I want to remind you that we're going to convene at 1:30 in the Mississippi room, and is that the third floor? I can't see you very well. It's the third floor. And there are signs in the hallways to direct you, Mississippi room. For those of you who are planning on eating in the building, you have several options. There's a food court on the lower level, and also, as I mentioned earlier, we have passes for any of you who would like to eat in the campus club, and that is on fourth floor. So thank you all, and we'll see you again at 1:30.